I know acromion. Here is the spina, medial border, angulus inferior. We have this triangle we just explored. Okay, and from here the muscle fibers go to the tuberculum majus of the humerus in this direction, in this direction, in this direction. This I have to visualize. Okay, so these fibers here on the lateral part go in this direction, and the fibers here, they go in this direction. And you see, if I go perpendicular to the fiber, here I have to palpate in this direction, but here I have to palpate in this direction. I have to know exactly where, here, and here, and here. And I make first this overview examination. Where are the taut bands? And you hear the reaction. Here I feel, you can see here it makes plop. And it's very different from this part and this part. And this I have to explore here too. Here is a big, this is a very big taut band, and this is a small and strong taut band, and you can see the reaction of the patient is very easy to read and to know where I have to continue. So I go to this taut band. If it's too much, you say stop. It's okay. Here I can feel a very thin but pronounced taut band.
굉장히 얇고 부드러진 타우트 밴드가 지금 저 지점에서 느껴지고.
So first criterion is taut band. Second, I follow the taut band and we explore, is it equal in each part?
타우트 밴드 어딘지 찾고 아픈지 알아내고 다른 부위랑 같은 반응인지.
And you hear and you see, I know where is the hot spot. Spot tenderness. It's okay?
이게 스팟 텐더니스 아픈 점입니다.
It's okay?
너무 참지 말고 태블.
Okay. It remains local or there is an irradiation?
터지나요? 가만히 통증이 유지됩니다.
It little refer.
Little refer.
Yeah.
To where?
To the deltoid.
You know this pain from your everyday life?
Sometimes.
Sometimes. So we have an active trigger point. Okay? Because he is familiar with this pain. If he would say, no, I don't know it, it would be a latent trigger point, and then I should look further and find a point where is it possible to make reproduction. Okay, I have an active trigger point, and now I practice just technique 1. I stay on the point, and I wait.
기법 1은 지점을 찾고 누르고 가만히 있는 겁니다.
Pressure, manual compression of the point without moving is technique 1.
움직임 없이 가만히 있는 게 기법 1.
Most often I don't wait very long in this position. I start here to move a little bit.
체중을 더 실지 말고 여기서 조금씩 움직여주는 겁니다.
You see I move in fiber direction. The pressure is constant. And the movement, is it big or little? The movement in fiber direction, is it a big movement or a small movement? Small movement, very small movement. Is it fast or slow? Slow, very slow. So there are 4 criteria for this technique too. It is a movement, and this movement is in fiber direction. In fiber
5가지
direction.
방향으로 조금씩 움직여주는 게
Second.
아니 그러니까
Fiber.
근결 방향으로 움직여주는 게 테크닉 2.
Fiber direction
Yeah.
of the muscle. I follow the fiber direction. the pressure is equal every time, and it's a small movement, and the movement is very, very slow.
그래서 제가 좀 설명을 드리면 테크닉 1에서 우리는 그 허혈성 압박을 한 게 테크닉 1이고요. 테크닉 2는 허혈성 압박한 상태, 그 상태에서 조금만 근결 방향으로 조금씩만 움직여줘라 이 말입니다. 이 포인트를 놓치지 말고 다른 포인트를 이렇게 무지르는 게 아니라 그 잡은 거를 그대로 그 슬라이딩을 약간씩 시켜줘라 이렇게 생각하시면 되실 것 같아요.
Thank you for the support. You know it very well from the book, and so you can support me. How do you feel? More, less, equal?
More or less.
It's okay.
Yeah, that's okay. It's getting better.
It's getting better.
Yeah.
So the pain goes down. This is normal. And normal is about 10 seconds, 15 seconds, 20 seconds. Most often it starts to release the pain. This is normal. If it doesn't release, we remain, we wait for half a minute, for a minute, but then I have to change because my finger suffers.
그게 10분, 15분 뭐 계속 뭐 적용하면서 떨어지는지 아니면은 혹은 뭐 이게 남아있는지 리포트가 되는지 계속 물어보시면 돼요.
Okay. Technique 1, no movement. Technique 2, small, slow movement. Okay. Now, if I press here and we move the hand in this direction and in this direction, in this direction and in this direction. It is technique 1 or technique 2 or technique 3. You think technique 3. Okay. I'm not agreeing. We will see. The analysis of the situation is pressure, no movement, technique 1. Pressure with movement, technique 2. And if this is a model, this would be the trigger point, technique 2 would be like this. And if now I change and he moves, I make this. So this is also a technique 2. But this we call technique 2A,
Yeah.
and this is 2B. I change punctum fixum and punctum mobile. Technique 2A is my finger moves, and technique 2B is my finger rest, and the tissue under my finger moves. I show it again. I go.
테크닉 2 같은 경우에는 이렇게 눌러주고 내가 움직이는 거, 2A 같은 경우에는 눌러주고 내가 움직이는 거, 그 다음에 2B 같은 경우는 내가 가만히 있는데 환자가 이제 능동적으로 움직이는 거 하는 거예요.
Okay, I show it again. I'm on the point, and then I can move in fiber direction. This is technique 2A. Okay, or I can rest here, and I can move the muscle, and the muscle moves under my finger, and this is also a movement, so this is 2B. And this I can make passively or actively or active assistively. All possibilities are given. Most often I facilitate this movement, and then I say, okay, please continue with the movement in this direction, exactly, yes, and you continue with the movement, great, and you continue. So I practice most of it. So this is technique 2B. Okay, I pause, and then I can go away from the trigger point. It's not anymore a trigger point treatment in a sense. It's a facial technique. It's a release of the facial, of the muscle which has the or I go in this direction. And you see, his spina is in this direction, so I have to go to follow this fiber direction, like this. And this I can make with one finger. This is very strong, the effect. Or I can make it with my knuckles.
엄지손가락이나 넋을 이용해서 이런 식으로 긁어줄 수가 있는데 강한 압력으로. 근데 이거는 단연 트래거 포인트 기술이 아니라 이제 근막 기법이기도 합니다.
Here is important two things. No, three things. In fiber direction, but most important, slowly. Slowly, slowly. And caudally from here, it's just the latissimus. Though I can say hello to the latissimus.
여기서 이제 라티스머스도 바로 찾을 수가 있습니다.
And you see, this is latissimus. It goes here back. This is not teres major. I'm caudally from the angulus inferior, and so I know it can't be teres major. Okay. Then I continue here, and I know this part laterally, this is latissimus dorsi. And I know the teres major must lay in this side to the scapula. Now I give resistance for the hand, and you press against my knee, and then I feel and I see here the muscle which comes from the scapula, and this must be the teres major. And release, please.
테네스 메이너가 이제 생긴 게 여기서 이렇게 이어가서 가기 때문에 테네스 마이너는 당연히 여기서 만질 수가 없고, 반대로 테네스 마이너는 여기서 이어가기 때문에 테네스 메이저가 없기 때문에 구분해서 만질 수가 있다.
Exactly. The easiest way. I start laterally, I know this is not teres major, and then I know it has to be here. Okay. And release. Now this is a muscle I can approach from two sides. Here I have a flat palpation, infraspinatus teres major, and if I can approach to the muscle from two or three sides, I go with pincer grip most often. And you see, this is a snapping palpation. I can feel here the bands, the taut bands, the part of the muscle. I'm like this. Okay. So here inside are two muscles. It's the outer part is here the latissimus. I don't press it. I press more medially here the teres major. This is just teres major.
요 라티스모스 돌지를 측정할 때는 여기서 이렇게 들어갈 수는 있는데 이 공간을 눌러야지 여기 빈 공간, 이 손가락이 있는 공간을 누르지 않고 여기를 정확하게 눌러줘야 된다고 합니다. 핀치 그립을 사용할 때.
I don't take it like this. It doesn't work. I have to go to the thorax, to the ribs, and then to take whole the portion. And there is the latissimus dorsi, but I press not on the latissimus, I press on the teres major. Here. Please, resistance here, then I can feel it.
요렇게 하지 않고 요렇게
And
하는
release.
이유가 라티스모스 돌지를 빼고 여기를 만질 수 있어서 이렇게 한다고 합니다. 그러니까 예를 들어서 요렇게 해버리면은 라티스모스 돌지랑 같이 족제가 되기 때문에 요런 그립을 이용한다고 합니다.
Okay. And then I am looking for taut bands here.
밴드가 있고
I follow the taut bands. Criteria 1. It's equal the pain here and here.
어디 통증 있나 그 뻣뻣함이
It's equal.
Imperial.
Inferior.
or inferior.
Okay. So I can ask. Here it's more.
Yes.
Okay. It's too much. It's okay.
Yes.
Okay. So I have a look. Now this would be the trigger point. I stay on the point. And which technique I practice now?
어떤 거 해볼까요? 테크닉 어떤 테크닉을 지금
Two A.
Technique 2A, exactly. Huh? I go in final direction, slowly, slowly, little way, constant pressure.
따라 천천히 가볍게.
So I repeat the techniques. Which technique I prefer now?
지금은
One, yes. Rest. And now, no, 2B. Not 3. 2B. Slow down with the movement, yes. Also, if he moves, he has to move slowly because otherwise he goes very fast, and I have to inform the patient as to perform the movement. Like this, it's great, yes. Okay, this is technique 2B.
투비를 할 때 비슷한 솔루션 핸드레인지까지 다 같이 가는지 아니면 미들레인지에서
And
빠지면 안 된대.
no, I'm on the
빠지는 걸
arm.
잡은 상태에서 이제 어깨 자체 돌리잖아. 인터널 익스터널 로테이션 할 때.
Is it necessary that move patient body full end range to end range?
No.
It's not necessary.
Not the idea. Because if you move a long way, you have a long way without effect. You make. I find the point again. Here is the muscle. You see it, huh? Okay, fine, correct. Okay. Now you move, and do you feel the same pain?
그 움직임 때 통증이 계속 같은가요?
Huh?
끝이죠.
So feel the pain in end range.
In end range. Go in this position where you feel most pain.
제일 아픈 데까지.
Here? Okay, and if you release, you feel it too if you don't work?
스스로 안 움직여도 똑같은 통증이 있나요?
No. Now keep here the arm,
다시 유지해보세요.
take it. You feel it still?
똑같네.
Okay. Now I know it's not a trigger point under my finger. It's the movement which makes the pain, so I have to go with the analysis in this direction. This was not because of my pressure, it was because it's an end range pain. This can be a problem of the stretched muscle, not of the contracted muscle. It can be a joint, a capsule problem, it can be a lot of things. So I have to differentiate this clearly. But back to your question, if I'm on the point, and here is more, and then is less, and here is more, and then is less, and here is more, and then is less, it doesn't work to make a big movement, because here it doesn't make pain. I don't have any therapeutic effect. Then I go in this part where it hurts most, and it's a limited movement just there where the patient feels the pain.
통증이 너무 있는데 이거를 급하게 할 필요는 없고 환자가 허용하는 범위 안에서 움직여주면 됩니다. 그리고 아까 너무 많이 끝지점에서 끝지점까지 가면은 이 포인트를 눌러놨는데 근육이 수축을 너무 이렇게 이완을 많이 하면서 포인트를 놓칠 수가 있어가지고 이렇게 끝지점에서 이렇게 빠르게 하죠.
Okay, but very good questions, thank you. Okay, so we repeated technique 2, technique 1, 2A, 1, 2B, and now to the technique 4.
이제 4번 해보겠습니다.
The technique 4 is not a technique on a trigger point, it's a technique between two muscles. Okay. Because I want to go between the muscles, it's best to use a little bit of massage milk, because like this, you can look
스위스 제다.
Yes. Milk.
Yes. Chinese.
Okay. Because I don't want to hurt the skin, and if I go between the muscles, then I can irritate the skin too much, so I can take a little bit. Okay. I know I want to go between the teres minor and the teres major. Please press here again. Here I have the teres major, here the latissimus. If I'm here, I'm between teres major and latissimus. Shall I practice here the technique 4? Does it worse to practice technique 4 between latissimus and teres major?
디스퍼스하고 테레스 마이너 사이에서 정말 4번을 연습하는 게 사실 연습하는 베스트
Why? Shall I practice between teres major and latissimus or between teres major and teres minor?
아니 지금 말씀하시는 게 테레스 메이저랑 라티스무스 도이시를 하는 게 좋은지 테레스 메이저랑 마이너 사이를 하는 게 좋은지 이건 물어본 거 아니에요? 아니에요?
그게 메이저랑 라티스 돌지랑 그 사이에서 지금 하고 있는 거고 그걸 연습해 보는 게 더 좋다 이 말 아니에요? 그 마이너와 메이저는 구분하기.
아니 메이저랑 라티스무스 도이시는 기능이 똑같잖아. 기능이 똑같은 거를 할 필요가 있냐 이 말.
근데 왜 지금 그걸 하고 있는 거예요?
Yes, for
Yeah.
sure. You see, we have the teres major,
Yeah.
here, this thing, and this teres major
Yeah.
is neighbor to the teres minor, and it's also neighbor to the latissimus dorsi.
Yeah.
And though it's possible that there is an adhesion between teres major and latissimus, or between teres major and teres minor. And the question now is both important to release between teres major and latissimus, and teres major and teres minor, or is it more important to release here, or more important to release here? We can say this between teres major and latissimus, this is A, and this will be B. And which one is more important? B. Why?
아고니스트 안타고니스트.
Exactly.
Yeah.
There we have antagonists between teres minor and teres major, and teres major and latissimus are synergists, so it doesn't worth here to work. And it's very good to understand this, to repeat this, and in the decision-making process, you know, it doesn't worth to work here. You spend your time, but you have to work here. Here we will have a problem. Okay, great. So I have to find, once again, pressure. I don't have to stay here outside of the teres major. I have to go on this side of the teres major. This is very important.
Yeah, yeah.
Okay. And here you see we have teres major, and then this is teres major, and here is teres minor. I go between these two muscles, and then I go in this direction. Why? Because the muscle is like this sign. They come together from the inferior angle of the of the scapula, and if there is a problem, it will be here, not here. It will be here. So I start here where it's open, it's easy to get access, and from here I work in this direction where it could be a problem.
오케이
I think everybody has understood because my Korean is just.
그러니까 그 근류가 여기서 이렇게 부채처럼 이렇게 뻗어 나가는 형태고 여기서 만나고 유착이 되기 때문에 여기서부터 시작하는 게 아니고 이 공간이 있는 곳부터 쭉 들어가서 유착이 쉽게 생길 수 있는 곳으로 접근하는 거예요.
So take your time for the orientation. Please press here. It's not too strong, just easy. Press. Yeah, it's enough. It's just the activation of the muscle. It's not, you don't have to work a lot. It's just for the activation. I can feel teres major. I know I have to go in this direction, Now this is the structure. I go with my thumb here, and then I say, please press on the other side. Here, yes. And now I have the external rotator, and I can feel with this part of the thumb teres minor. And you press against my knee again, here, yes. And then I feel the teres major. And so I have the feedback. I'm really between teres major and teres minor. And this you make several times to be sure I'm between these two muscles. You change. Okay, teres minor and other direction. You press to my knee, other direction. Yes. Now this is teres major. Okay. Then I release and I go deep on the scapula. Now I feel the scapula. I rest profound in touching the scapula, and I go in very little steps in this direction to the angulus inferior. But I have to feel, is it possible to stay deep, or I lose the contact with the scapula? And then after 2 or 3 steps, I say press here again. Yes, I feel I'm correct. You move here, I feel I'm correct. It's all okay. Next step, I go further. Okay, here. Once again, you press here. Yes, I feel in this part, you change. In this part of the finger, the activation is perfect. Okay. And now if I go further, I feel I lose the contact with the scapula. I go up, and then I don't go further because it does, then I'm superficial. I rest in the contact with the scapula here, and then I'm at the end. And if I'm here, I move in this, a little bit in this, a little bit in this direction to release between teres minor and teres major.
It was so long, you know.
Yeah, I know. Just the last part.
어쨌든 좀 긴데, 아까 손으로 저항 검사하는 이유는 수축을 시켜가지고 정확하게 더 조직을 구분하기 위해서 한번 그렇게 시켜보는 것도 좋은 방법이고, 그리고 이거 누를 때 뭐 알겠지만은 1, 2에서 유지했던 거지만은 이 프레싱을 같은 수준으로 계속 유지하는 게 중요합니다. 스캐폴라 본이 느껴지는 위치에서 쭉. 근데 스캐폴라가 끝나는 것 같다. 뭔가 내 손이 근육 위로 볼록 올라왔고 더 이상 스캐폴라 없다. 그러면 거기서 더 가지 말고 유지. 범위를 정해주는 겁니다.
통증이 있어도 됩니까?
If it okay, we will still keep the pressure if patient have a many pain.
Yes, but often this is not a main pain because I'm not on the trigger point. This is very particular. You see, the trigger point in the teres major lies probably here, and here is a lot of pain. But here, I'm not in contact with the pain, the great pain of the patient. It's a structural problem, but it's not the hot spot of the problem. If it would be the hot spot, it's not because of the adhesion, then I would go on the teres minor or on the teres major and treat first the trigger points in this region, not with technique 4. I would treat with technique 3, with technique 2B or with technique 2A. I would change, I would look on the muscle where is the really hot spot.
짧게 설명하자면은 통증이 있기는 힘들게 이미 트리거 포인트를 지나가지고 이걸 쓸어가지고 그 근육의 끝지점에서 하고 있는 거기 때문에 트리거 포인트랑 별개를 누르고 있어서 통증이 유발되지 안에 강률이 크고, 그 다음에 부분적으로 이렇게 누르다가 또 다른 트리거 포인트가 아픈 데가 있으면은 또 아까 말했던 것처럼 사함을 다 쓰든 이를 쓰든 해가지고 상황에 맞게 사용하면 됩니다.
질문이 이거 트리거 포인트를 치료하는 거야? 어테이션 자체를 떼서 하는 거야? 테크닉 4잖아요.
사이를
그냥
시켜줘요.
그러면 이걸 할 때 약간 스트레치를 해서 하는 건지 아니면 아까 장력 길이 곡선에서 근육을 늘려서 하는 건지 짧게 하는 건지 그것도 한번 여쭤볼 수 있어요. 이게 만약에 테크닉 4를 할 때.
This technique 4 is for separation of the muscle, right?
Exactly.
So if we use this technique 4, we need stretching patient's arms. Is it essential?
It's like this. If you want to enter between two muscles, it's better not to stretch the muscles, because if they are stretched, you don't have the space to enter deeply. It's
Yeah.
better.
이 근육이 늘어나 있는 상태가 되면은 서로 사이에 공간이 오히려 더 작아질 수가 있기 때문에 이 기법은 근육을 만지는 게 근육 사이를 만져야 되는데 서로 타이트해지면은 그 들어갈 공간이 없어져서 스트레칭 하지는 않고 진행해요.
If you want to enter here, it's better it's not stretched. If it's stretched, it's difficult to enter. It's better it's not stretched to enter. But this is in opposite to the technique 3. The technique 3 is more efficient if you go in pre-stretch. So if you have the possibility to go in pre-stretch, then you can use this. This is a very good solution for technique 3, and we go in pre-stretch, but not for technique 4.
4번에서는 아니지만은 반대로 3번에서는 이렇게 프리 스트레칭 포지션을 만들어 놓고 적용을 하는 있습니다.
But most shoulder patients, they can't move like this. They have a problem, so you have to go just in the area where it's pain-free. This is more important because there is pain, there is a restriction.
대부분의 환자가 아파서 저 정도 각도까지 안 나오니까 당연히 통증이 없는 각도까지만 스트레칭 만들어 놓고.
So you go just as far in pre-stretch that there is no pain.
프리 스트레칭 모션도 통증이 없는 범위에서.
Okay, so please first identification of the scapula, then you feel here the latissimus. You go here, latissimus, then you know middle teres major. You repeat at the teres major, technique 2, technique 1. Then new, technique 4 between teres major and teres minor. And to the end, you repeat technique 3.
그래서 라티스머스부터 스캐폴라에다 오주고 그 주변에 있는 트레스 마이너 메이저 다 찾고 기법 1, 2, 3, 4 정도로.
Okay. Please keep your arm here. Yes. A little bit in this. Stop it. In this position. Yes, perfect. And you see, this is the clavicle, and this is pectoralis major, the clavicular part. This is deltoideus, and this is the Mohrenheimsche Grube. I don't know if it exists also in English, but this is particular. There is a little space. You give resistance, you can see better. Here we have this superficial part, clavicular part of the pectoralis major, and then there are the other part, the sternoclavicular part and the abdominal part. Okay. The muscles forms the anterior shoulder fold, and if I take it like this, I have all parts together. This is very comfortable, very easy, you can practice like this.
이렇게 잡으면 전체 섬유를 다 잡을 수 있습니다. 이거 되게 쉽다고 합니다.
You see, I can move very comfortable here, and this I can use during the diagnostic procedure.
이렇게 잡고 움직이는 게 이거 진단할 때 가장 쉬운 그 베스트 포지션이에요.
We said as first we are looking for taut bands.
일단 타우트 밴드 찾아야 돼요.
And if I move like this, first there are the taut bands which are stretched. When I make a little stretching, the first structure is stretched, the taut band. And so I can examine very easily and find the taut bands.
이런 식으로 살짝 스트레칭하면서 어디 타우트 밴드가 있는지 느낍니다.
Okay. And then I go and I identify the taut bands again. okay?
괜찮나요?
If I have taut band, I'm looking for painful areas. It's equal every part, or where is
No.
it more? Here is more.
Yeah.
It remains local, or does it refer
Local.
local? Do you know this pain?
No.
No. So it's no trigger point in the course between this. Okay. And you see, I have again this piercing or pincer grip because I can reach this muscle very easily in this way. Now I can move like this. Which technique I perform?
저 무슨
2B.
2B, exactly. And here, this works very well. It's easier to move here than to move here. And I'm looking for the easiest way. This is very comfortable.
저희가 요거 할 때 제일 쉬운 거 한번 찾아봤는데 지금 요 형태 핀치 그립 사용해서 이렇게 하는 게 가장 쉬워요.
Left part.
Hmm?
Left part.
It goes to the finger?
Yeah.
Okay. Then it could be because of the pressure or because of the position. So it remains in the finger. Irritation.
손가락
끝에 여기.
Okay. Then I remain in the position but without pressure. It remains in the finger.
이렇게 압력 없앴을 때도
Remove.
remove the pain.
Yes. So I know it's not the position. Okay. I changed just one part. I released the position. I rested in the position, but I didn't press anymore. It's okay now?
Yeah.
Okay. And now I know it's not a nerve problem, because if it would be the nerve in this position, it would remain. So I am searching again. So you have here a latent trigger point with an irradiation in this part.
이게 만약에 신경 문제였으면은 이렇게
Here I can
포지션을
feel.
유지하고 압력은 뺐을
Left
때 이게
It
유지돼서
comes
쌓이는
again.
통증이.
You see, it's for sure the pressure and not the position. I can release again. Does it go away?
Yeah.
Yeah. It's not a neural problem. For sure. This is caused myofascial.
다시 반복해봐도 힘 줬을 때나 뺐을 때 힘을 줄 때 통증이 있고 압력을 뺐을 때는
Left
통증이
foot.
없어지니까
It comes again.
이거는 마이오파샤다.
Do you know this from your everyday life?
No.
No. Not problem, no problem. Okay. Treating, I could continue like this. It gets worse.
계속 심해지나요?
Equal.
Equal. Treatment would be like this, slowly, slowly. Equal or worse or better?
Decrease.
Decrease. See. This would be treatment. Okay, this is this part. This is most common, very easy. If you want to examine just this clavicular part, sometimes it works, sometimes it doesn't work. You can try it here again, you take it here, and sometimes you can take just this part like this, or you go through behind this muscle and you have just this part. But here I can't take it isolated, no problem. I will take it like this, clavicular part. Then we have here the sternocostal part, and there sometimes is the irritation and the trigger points are very close to the ribs. It's on the insertion side where there are the problems.
간혹 가다가 요 베비뼈에 가까이 붙어 있는 스터너 파트에도 트리거 포인트 문제가 있다고 합니다.
This sometimes is a very local problem here. In German literature, it's as Tietze syndrome. Don't know if it exists also in
Refer.
refer.
Yeah.
Where? Again.
Yeah.
Okay. And now I don't know, you see, I press the muscle, but not only the muscle, I press also the ribs. And the ribs, there is a connection behind to the spine, and so I have to differentiate, is it the pressure on the muscle or is it the mobilization of the rib and probably of the spine. It goes away.
갈비뼈가 척추에 연결돼
Okay.
있어서 이게 척추
And
모빌라이제이션에
you
대한
see-
것도 효과를 줄 수 있기 때문에 우리가 근육을 누르는지 립을 누르는지 명확히
Now I perform the same movement of the rib, but with a flat contact, not with a point. Does it irritate to the arm?
No.
No. So now I know it's not an articular problem, but it could be. I have to differentiate step by step. But now I know it's not the mobilization of the rib or of the vertebrae. And now I go again. It comes again?
Yeah.
Okay, now I know it's a myofascial problem, but I have to differentiate every time. Is it a joint problem, a myofascial, a neural problem? And we can make this task, in this case, without problem.
척추 모빌라이제이션을 또 따로 해봐서 그게 이제 증상이 있고 없고에 따라서 이게 관절 쪽의 문제인지 마이오파셜 문제인지 구분하고 지금 보이는 것처럼 여러 원인에 의해서 증상이 나타날 수 있기 때문에 우리는 구분을 해야 되고 충분히 연습하면 할 수 있습니다.
Okay, so the treatment would be here, like this. Which technique?
어떤 기법이죠 지금?
2A, exactly. And you see here I can't perform a 2B, so I don't practice it. It's no problem. I don't have to make every technique in every case, but I can adjust it here. It's very comfortable to practice a technique 2A. Okay. Then we have from here, I can follow the muscle in this area.
이렇게 근육을 따라가면서 만질 수가 있는데
Okay, and with ladies, I have to say if it's comfortable, I can continue, and you have to go under the breast tissue, and it's no problem because you feel the muscle here. But if the lady don't want that we treat here, it's no problem. They can say stop, and then we will not treat. But here often are trigger points.
그래서 여성의 경우에는 저 지점 밑에 지점까지는 치료하는데 한계가 있어서 당연히 이제 뭐 어떤 이유에서든 동의를 구하지 못하면은 저 밑에까지는 안 해야 됩니다.
Yeah, in German-speaking part of Europe, it's no problem to treat like this, but in French or Italian or English-speaking part, you can't work like this. It's very different from culture to culture, and we have to respect this. It's clear.
독일에서는 별 문제가 안 되는데 이제 프랑스나 다른 데서는 문화적인 차이로 인해서 그렇게 하지는 않았다고 합니다.
But from a medical point of view, it would be very helpful to treat here, because one of the causes for the overlead is to keep things in this position. And if you work in a restaurant, you keep all day like this, and then you have these problems. You get shoulder arm pain, and you can't work anymore. And these are often ladies, and you have to treat them in the whole chain of the problem. You can practice this very well. Then we have this part. Please go with the hand behind the neck. Okay. And in this position, yeah, you can go down. It's a stretch of the muscle. Patient often can't go as far as you. Then I put here a cushion to
이렇게
please.
이렇게 스트레칭, 프리 스트레칭을 하고 기법을 적용할 수가 있는데 만약에 환자가 요만큼 멀리 팔을 못 뻗는 상태면은 여기 밑에 베개 하나 깔아서 시작하면 됩니다.
Yeah. And then you come up with the elbow and down and up
지금 저항 검사하고 있고요.
and down and up. And then I can feel here the contraction of the muscle, and I can treat it if necessary. Okay. Then we have the facial separation techniques. We perform today just one. There would be 3 parts necessarily. There is the separation from the pectoralis major, from the deltoid. Then separation pectoralis major to pectoralis minor, we don't practice today, and the separation from pectoralis major to here coracobrachialis biceps couple brevis, we don't practice it today. Today we make just the separation between the pectoralis major and the deltoid.
이 부분에서 이제 우리가 근막 분리 기법으로 분리할 수 있는 구조가 3가지가 있습니다. 펙토라리스 메이저, 마이너, 델토이드, 앞섬유가 있는데 오늘은 이제 마이너하고 메이저 구분하는 거는 연습 안 할 거고요. 이제 메이저하고 델토이드, 앞섬유하고 구분하는 것만 연습할 겁니다.
It's enough for today. But try to release the muscle, no stretch, and then I take the muscle between 2 fingers and I follow the tendon of the muscle up to the bone, that I can feel here the humerus, and then I'm in the correct position between, here is delta, plomb, this is deltoideus, and I'm between the pectoralis major and the deltoid. And if I am here on the bone, then it's appropriate to go in a little stretch, but I'm just entered, and then I can make here a technique 4. This would be a technique 4B. I move here, or I can stay here and move like this. This would be a technique 4A. It's the same as with technique 2A, 2B.
우리 테크닉 2A랑 2B랑 구분했던 것처럼 호에서도 우리가 그 근육 범위를 가동 범위를 가져가냐 안 가느냐에 따라서 테크닉 4도 A랑 B로 나눌 수가 있습니다.
Is that? Okay. And then we have the technique 3. We go in pre-stretch. For the clavicular part, I go in transversal abduction, and I go in this way. It's okay?
네. 프리 스트레칭하고 기법 3 적용할 수 있습니다.
This is for the clavicular part, and for the rest, I go in diagonal abduction.
대각선 벌림에서도 적용을 할 수 있습니다.
Also in pre-stretch. It's okay?
올려볼게요.
Okay. Technique 3. It's okay?
올려볼게요.
Slowly, slowly, slowly. Okay, so first pectoralis major identification. You keep your arm here. Orientation clavicle, pectoralis major clavicular part, deltoideus. You start with this, and then you go around.
먼저 이 포지션을 유지해가지고 펙토라리스 머슬이 어떻게 생겼는지 확인을 합니다. 그래서 클래비클 밑에 있는 클래비클 파트 섬유를 먼저 찾는 걸로 시작을 해가지고 실습해보겠습니다.
Okay. Here the taut bands. Okay.
어깨를 조금 이렇게 패시브하게 올리면은 처음에 근육을 만질 때 전체 근육 만질 때가 좋고, 그다음에 조금 스트레칭을 하면은 이제 타우트 밴드를 찾을 때가 좋습니다. 그래서 우리는 올려서 근육 찾고 내려서 타우트 밴드 찾고.
Exactly. So here I can feel these taut bands. I follow the bands now. I look, is there a side more sensitive? It's equal in each point.
만질 때 다 똑같나요?
네.
Yes, he's saying yes.
Okay. So if it would be here more intense the pain, I would press this and I could move like this. Trick. Which technique?
이거 몇 번이죠?
To be exactly. You repeat the techniques here. To be or like this. 2A. Now I feel I get tired with my fingers. I have to change.
손가락이 너무 피곤하고 이러면 바꾸면 됩니다.
Now this is very important to feel. When it's enough, then I change. With the other hand. It's okay? Which technique now?
기뻐도
Word one. Yes, sir. I rest. And if you rest, often you can feel a release in the muscle. It releases. The pain remains local.
그것만
No headache. Okay. So you are looking for the trigger points first in both muscles, trapezius descendens and transversus. And then you change, you are looking just for the upper trapezius. It's just one part here in front. And you can see here very well the twitches. You see? Pluck.
No.
We call this snapping palpation. Palpation and snap. Plop. It hurts a little bit if it's too much, you say so. But you see the course of the fiber very well, and you can follow this. It goes here in this area. So we have here this border of the trapezius.
You want that color?
Yeah, I no. I continue. Okay. So you have to feel this snapping here, and you know it's better another color. Sorry. I have to keep the feeling here, otherwise I have to start again with the whole palpation. So here we have this thin part. Yeah, you see it before. It's okay. This is the border of the upper trapezius. Okay. And black, please. So. And this is the border of the medial trapezius. Okay.
Yeah.
And you see the part of the upper trapezius, this is very small. It's a very small part. And the other is a big part. Okay. And it's challenging to identify this upper part here. It makes sense to get this upper part, because if you want to make a technique, or it is a separation technique, you have to be aware that you practice this at the red border, on the border of the trapezius descendens, and not here. Okay, you have to go here inside, before the trapezius descendens. And to reach better into this facial separation technique, I make elevation again. Yes, very well. And I support here the tissue, and then I go on the border here inside. Okay? Because if it is tensed, you can't get access to this separation technique. So I make an elevation. Perfect. And then I follow this border. And for this I need a little bit of this body milk, and you need short nails, otherwise it's not okay. Okay, and then I explore this space. I go here inside. This is a separation technique between trapezius and which muscles?
Levator,
Levator and scaleni, yes, and
스프레니우스.
splenius, cervixis, and capitis. Yeah. You can float now for the moment. If you know the muscles, it's okay. Otherwise, it's also okay. We will treat the other muscles, levator, scaleni, in the today and tomorrow, and then we will clarify the situation. Okay, so please be aware of this part of the trapezius. Okay, and then we have the technique 3. Here it's better to go in pre-stretch. I can make depression, and now I can treat in this way. Or if this is too little, lift your head a little bit. I have here a lateral flexion of the head, and so I have more pre-stretch. I can make it in this direction, or for me, a therapist, more comfortable is I stay here. I can make depression of the shoulder, and now I can make with my knuckles here the stretching of the fascia with technique 3. This is very comfortable. You see, I can push with my whole body, and here I'm with my elbow on my body, and the weight of my body is working. It's okay for you?
Yep.
Very slow, very slow.
저희분들은 요 오른쪽 팔꿈치도 어디 있는지 보시는 게 좋습니다. 방금 치료자를 위해 좀 편하게 적용할 수 있는 법한 스캄에 대한 것을 추천하는데, 이렇게 하면 체중 실어서 왼쪽을 이용해서 디프레션도 할 수 있는데, 오른팔이 이렇게 되면은 여기다가 또 몸무게도 실어서 프레스를 갈 수가 있기 때문에 저희분들은 요것도 한번 추천드리겠습니다.
Okay, thank you so much. Please practice this problem, because the trapezius overlies the supraspinatus, and so I see there are situations where I can't get these 3 criteria. So if possible, we follow these 3 criteria, but here it's not possible. So I have to change. For these 3 criteria, I have 1 criteria I can't reach, the taut band. 3 minus 1 gives 2. So we have 2 criteria, spot tenderness and pain recognition. So how to diagnose the spot tenderness? There are 2 ways. One way is, I don't know in English, you will see. I know here must be the supraspinatus. I can't palpate it directly, but I know, because I know the reference points from the bones, it has to be, without doubt. So I can start like this. I know under the trapezius here will be supraspinatus. I start with the pressure. Okay. 1. And then I make a dislocation. I make the same pressure. It's more or less pain? Equal. I go 3rd position. More or less? Less. So I know here will not be the trigger point. I go back in this area. More or less. And here? More or less? Equal? And here? More. And here?
less,
And here?
less,
And here?
more,
More. Now you see, I know here is the area spot tenderness. Huh? I can.
지금 우리가 3가지 그 임상 진단 기준 최고 포인트에 대해서 알고 있는데, 여기 스프라스파이너투스 같은 경우에는 트랩 머슬들에 의해서 가려져 있기 때문에 타우트 밴드를 찾는 거는 조금 한계가 있습니다. 그래도 우리가 그거 하나 말고 2가지 기준이 더 있잖아요. 그래서 지금 방금 타우트 밴드를 찾는 과정을 생략하고 스팟 텐더니스를 찾기 위해서 여기 눌러보면서 느낌을 물어보는 거예요.
Okay. So I start with the criterion 2.
Roland, how do we know that this spot is from supraspinator or from the trapezius muscle?
Super, we will speak about it. Next step is very important. Next step is I have the criterion 2, spot tenderness. Now I am looking for pain recognition. This is next point. Does it hurt? Yeah. Local or referred pain? Local. Okay. Now it would, you know this pain? No. So it's a latent trigger point. But if now we could reproduce the symptoms of the patient, it would be an active trigger point. And you're absolutely correctly, how can I know the trigger point lies in the trapezius or in the supraspinatus? This I have to differentiate. It's no problem. Now I know I have an active trigger point in the trapezius or in the supraspinatus, and to distinguish, I rest on this point and I take just the supraspinatus with pincer grip. And if I can now reproduce the same pain, patient is familiar, I know the problem, trigger point in the trapezius. But if it hurts now, but it's not the pain familiar with, then I know the problem is in the supraspinatus. Okay? So you can differentiate without problem. Or, please.
자, 질문은 트라페지우스랑 스파이널스파이너투스의 그 각각 어디서 나오는 아통점인지 어떻게 할 수 있냐는 질문이었고, 그래서 이제 증상 유발을 통해서 할 건데, 그러면은 두 가지 근육에 대해서 다 아통을 넣어보는 겁니다. 그래서 방금 한 거는 이렇게 어퍼트랩이랑 같이 잡아가지고 통증을 유발을 한 건데, 이때랑 이때랑 다른지, 아니면은 요거 한 거랑 그 개별적으로 스파이네투스에 대한 아통적으로 유발한 거랑 같이 이렇게 잡아서 한 거랑 또 다른지 같은지 그걸 본다는 겁니다. 그렇게 해서 이렇게 구분해 주셔야 된다.
아니 그러니까 처음에 슈프라를 했을 때 통증이 재현된다고 쳤을 때 이 통증이 트라페지우스의 통증 때문에 일 수도 있잖아요. 그걸 감별하기 위해서 핀서 그립으로 해보는 거죠. 핀서 그립 했을 때는 트라페지우스밖에 안 되기 때문에 그때 통증이 재현된다면 트라페지우스의 문제고, 그래도 통증이 재현이 안 되고 원래 그 처음에 했던 통증이 그대로 나타나지 않는다면 얘는 슈프라의 문제라고 생각하시면 된다 이 말이죠.
Okay. Yeah. Perfect. Then a second way to find, we had first way with this provocation 3 or 4 times. Second way is I start here with a deep pressure. I take a little bit of massage milk. I go very deep, and now I make a technique 3, like with a plow. It's equal. And you see, I find exactly the same spot. Yeah, this is trapezius. Okay. So with this technique 3, I can make diagnosis 2. This is very, very efficient because I treat and I make diagnosis at the same time. So I am looking for the hot spots, the spots with tender spots, and I'm on the same point. Okay, and then I have the spot tenderness. I am looking here for reproduction for pain. Okay.
이렇게 아까 기법 3 같은 경우에는 이제 치료로도 적용할 수도 있고, 이제 로랜드 같은 경우에는 요거 자체로 하면서 이제 팔페이션과 동시에 자기가 진단을 찾기도 한답니다. 치료와 동시에 쭉 훑는 거죠.
So we can find the trigger points.
그래서
To treat the trigger points, it's very heavy for my finger, and so I take a wooden tool.
이 엄지 엄청나게 힘이 들어가는 거라서 아프거나 손가락이 이러면 이렇게 우든 툴을 사용할 수가
The
있어요.
diagnosis I make with my fingers, but to treat I don't press with the finger because it hurts too much. I take a wooden tool, and you see I can take it like this. It's very important. And then I can push with my weight. It's important not to make like this, because like this you have to press again with your fingers. You have a little benefit. But if you can press with here, with the palm, then you can, without finger activation, you can treat it perfectly.
그래서 스프라스파이너투스, 트라페지우스가 아니고 스프라스파이너투스라고 판단이 되면은 이제 프레셔를 압력을 더 깊게 넣어야 됩니다. 밑에 있는 근육이니까. 그런 경우에는 자기는 이제 다이그노시스를 결정할 때는 감각에서 손으로 하는데 치료를 할 때는 이렇게 내 부담을 안 주기 위해서 이렇게 툴을 씁니다.
And I treat like this. Which technique we perform?
여기가 보시는 게
2A, you see, same. Or I say I stay here, and you come with your arm in this position, and then in this position again. Oh, excuse me. You change in this position, yes, and outside. And inside, which technique? Yeah. Okay, and this is
The shape like that.
yeah. Okay. This is the must program. Now there is a supplementary program. I show a specific technique for those who are just familiar. If it's too much, you don't practice it. But you can reach a part of the supraspinatus directly. I have to show it from the You see, the supraspinatus is in this fossa supraspinata, and I can palpate here the angulus superior, and from the angulus superior I can go directly on the muscle. It looks like this. May I sit? So I like to sit because I have to be deep. If I'm here, I have to make like this. I go up a little bit.
이 스프라스파이너투스를 직접적으로 치료하는 거는 좀 연습이 되지 않으면은 이렇게 많이 힘들 수도 있습니다. 방금 포지션에서. 그래서 좀 더 컨택하기 쉬운 거를 지금부터 알려줄 거고, 그 중에서 자기가 이제 좀 더 딥프레싱을 넣을 때는 여기서 하는 게 아니고 이 지금 같은 자세에서 할 거고, 자세한 거는 또.
Okay. I take a little bit of massage milk because I have to perform a technique 4 first. I'm on the ventral border of the upper trapezius. So I have to find here this ventral border again. We practice it. I go on the ventral border and then I go with 1 or 2 fingers. I rest here and I make passively an elevation of the scapula. With this hand, you see in this position, I can lift it, shift it upward, and here with this part of my hand, I'm at the acromion. Here I can make depression, and here elevation. And moving like this, I be aware I'm ventral from the trapezius. The trapezius is relaxed, and here I can feel the angulus superior of the scapula, the bone. It's very easy to feel here. I move and I feel, oh, it's a heart, it's the bone. And from this point, I go laterally, and then I press in the fossa supraspinata, and here I am on the supraspinatus. Okay.
손톱 때문에. Because of your name.
Yeah. This is also part of the
포지션에 대해서 이게 딥하게 스프라스파이너투스에 들어갈 때는 손을 이용해서 엘리베이션을 시키면은 이 트라페지우스가 이완되는 포지션에서 요 사이로 가쪽으로 여기서 가쪽으로 들어가고 있습니다. 가쪽으로 가운데 middle finger.
Okay. Huh?
It doesn't matter which one finger you use.
You can try it like this or like this. I prefer the third one. Or you can make like this, but I prefer this one. And then if you stay here, you can say please come with your elbow outside. Yes, the hand rests on the bed. And now you go in this direction again. Yes, and you come outside. Perfect. And so sometimes you can feel the abduction. Not every time, but sometimes you can feel more and less tension on the supraspinatus. This is a confirmation.
항상은 아니고 이렇게 주동작용을 계속 반복시켜 봤을 때 항상은 아니고 가끔 근육이 텐션이 생기고 안 생기고를 느낄 수가 있다고 합니다.
I'm performing this. It's which technique?
이거 무슨
2B again. Exactly. Okay. Yes. You can try it or you can leave it away. But first, this orientation and then you go on this pose. Yes, please.
일단 찾는 거를 시작으로 해서
Thank you so much. Here side, I start with the examination on the left side.
아까 이쪽으로 검사를 했는데 이번에는 반대쪽으로.
No, you can stay there. But I have to go a little bit more.
You can do this by the light. Yes.
Ah, it works.
This.
Oh, great. So it's almost like a hole.
You can use one.
On this part. Okay. At home, I can make like this and like this. All around, this is very comfortable. So I can, on every part, I can adjust the height.
Yeah.
But also this is very comfortable. Okay. So, first I look the rotation on this side. And you see also here, it's not too much. It's restricted, but no problem, because I have to know what is the individual range of motion. This is not for every person the same, and I can't expect on the infected side more than here, but I know it doesn't hurt. It's okay here. Okay. This is normal. This is normal.
개인적으로 갖고 있는 가동 범위가 다 다를 수가 있기 때문에 처음부터 바로 여기서 움직이는 것보다는 이렇게 나이스가 될 수 있는 방법이 있습니다.
I make it in this position because the bed helps me that there is a very good assessment situation, because the elbow can't go in another direction.
펜치가 이렇게 갈 수도 있으니까 이렇게 막아보는 상황에서.
And you see, it's more or less equal now. For him, it's normal, but here it's okay. No problems. Here too.
그래서 가동 범위 다르면 문제는 있고.
So I see there is no indication directly for the subscapularis. The length is okay. But if this would hurt now, the pain the patient is familiar with, and there would be no problem, which part of the subscapularis would be infected? The transverse fibers or the diagonal fibers? The transverse fibers. But if this would be free and the problem would come here, I have to think about the transverse fibers. Okay.
그 섬유 방향에 따라서도 각팔 각도에 따라서 그리고 섬유 방향 생각하면서 또 이 섬유는 괜찮고 이 섬유는 괜찮고 같은 서스페이스를 하면서 사실 그런 방식으로 문제를 삼기도 한다고 합니다.
Okay. This treatment is challenging for the patient and challenging for the therapist.
인디스퍼서.
Yes.
서브스케플라리스 치료 같은 경우에는 치료사도 하기가 힘든데 환자도 굉장히 받기가 힘들죠.
It's mostly, yeah, it's very heavy for the therapist, for the fingers, and it's very painful for the patient.
아프기도 하고요. 치료사 손가락도 아플 거고.
And I have to inform the patient it will hurt.
그래서 미리 이게 아플 끼다 말해주시고.
And please say stop if it's too much.
너무 아프면은.
Yeah, it's important, because we go between the thorax and the scapula, and we are not used that there nobody goes in this area.
여기를 막 이렇게 만지고 하는 거는 거의 다 안 하기 때문에 굉장히.
Okay. there are different possibilities to have the grip, but I will show you 3 possibilities.
그립이 다양한데 이거 다 보여줄 거라서.
First, you come to my side, please. Perfect. And I will be with my elbow. I go to the acromion.
아크로미온의 팔꿈치 되고요.
Here I keep the forearm, and so I can make here with my elbow depression of the shoulder.
그래서 팔꿈치로 견갑 하단 상승할 수가 있습니다.
With the other hand, I feel here the ribs,
갈비뼈
and
당기고.
first I feel here the serratus anterior.
저 방향에서
And if this hurts too much, I will start with the treatment of the serratus anterior. But if
이때
this-
벌써 너무 아프면은 SH로 하고 가죠.
Okay, if this is okay, I move now the shoulder to the ear and far away from the ear
그래서 귀 쪽으로 가까이 갔다가 멀어졌다가.
to feel the movement. With this arm, I make depression, with this elevation. Okay, because I have to feel this is free. If the patient is tense, I can't reach to go inside. It's no way.
이때 환자가 벌써 여기서 불편함을 느끼면은 한쪽으로 들어갈 준비를 하지 않는
Then I feel here the posterior part of the shoulder, and I go between here the scapula, between the ribs and the scapula. I stay here, I move, and I'm every time in contact with the ribs here, and I'm looking for the lateral border of the scapula, and this I can feel moving every time a little bit. That which moves is the scapula, that what does not move is the thorax, the ribs.
여기 어깨를 이런 식으로 계속 움직일 건데 뭔가 그 기조는 갈비뼈가 만져지는 그 경계선과 요 어깨 뒤쪽 경계선 사이를 만지는 거고요. 그러니까 다시 말해서 갈비뼈가 안 느껴지는 깊이까지 뒤로 가는 게 아니라는 거예요.
그럼 서브스카플라리스 지금 누르고 있는 건 아닌 거죠?
Is that are you touching the subscapularis right now?
Just a little bit. I touch now. Where is the border of the scapula? And you see now I go inside a little bit, so I touch it a little bit.
지금은
This is the
아니고
border.
조금 안쪽으로 더 가야 됩니다.
And then you go inside between scapula and thorax, and now I touch a little bit the subscapularis. I move and I glide here inside. That's great. You can release, and this is important. I have to feel, can the patient rest released, then I can continue. And if he makes like this, it doesn't work to continue. Okay.
그런들은 환자가 긴장하거나 수축하는 게 느껴지면은 더 이상 이제 치료 그 힘 빠질 때까지 진행하지는 않습니다.
So I perform a technique 4.
4번 한번 해볼 거예요.
Technique 4 between subscapularis and serratus anterior. And you see I go slowly, step by step.
천천히 하고 있는 거 다 보이죠?
It's okay for you? It's great. You can rest very calm. Okay. So first I make this technique 4. And then I make like this with my finger. And then I perform technique 4 plus technique 1 or 2. Okay. But firstly, I have to perform this technique 4.
자,
Once
일단은
again.
먼저 4번을 하기 위해 손가락 이런 모양으로 잡을 건데 그러다가 이렇게 바꿔서 움직이거나 아니면은 움직임을 만들거나 해서 4 플러스 1 아니면 2 보여줄 거라고.
Now it's technique 4. And now I make this movement with my finger and it hurts a little bit more. It's okay?
오케이.
Okay.
움직임 좀 더 만들
Great.
겁니다.
If this would be an active trigger point, I would move like this. You see, now I make internal external rotation, and now I have a technique
2B.
2B. I have 4 plus 2B, both together. Okay. It's okay?
오케이.
Great. But for me, it's very, very strong work for my fingers. I practice this just 2 times a day, And then it's finished, it's over for this day for my fingers. Please be careful. Okay. But this is first approach, huh? From that. Second is very similar. Excuse me. I go in this position and I take with my hand the shoulder blade. I don't make this, huh? If there are problems with the shoulder, it's not okay. But I take the shoulder blade and then I can move forward and back. Okay.
면을 받치는 겁니다.
Then I go on the same side as before.
아까랑
And
같은
then
방향으로.
I pull here the scapula over my finger. Okay?
손가락은 여기 있고
And
스캐폴라를
then-
이쪽으로 잡아당기는 거죠. 손가락 쪽으로.
Then I go back with the shoulder and my finger on the right hand. My right hand rests and I pull again the shoulder over my fingers. It's a very dangerous technique.
방금 그거 굉장히 위험한 동수 기법이라고.
We are happy that there was no fall and no reason to treat the subscapularis after falling and
근데 이게 조금 안 다쳐서 기쁘긴 한데 만약에 다쳤으면은 실제 환자 그 낙상에 의한 실제 환자를 볼 수 있었다고.
Okay, once again I start, I pull here, then I go back, my right hand rests and I pull again over my finger. It's very, very heavy. If it's too much, you say stop. I can move here, technique 4, and I can press more in this direction.
그래서 요거 할 때 어떤 느낌으로 잡아당기냐면은 받치고 있는 손가락이 누르고 있는 손가락과 가까워진다는 느낌으로 이렇게 하는 거예요.
Okay. Third part is less intense. You go here.
세 번째는 강도는 조금
Now
낮은 겁니다.
I treat this part of the muscle, which is lateral from the lateral border up of the scapula.
가쪽에서 이쪽 면으로 하는 겁니다.
This is latissimus anteres major. I go inside. I palpate here the lateral border of the scapula, and from here I follow the muscle to the humerus. It's okay?
한국 욕은 못 알아들을 거예요.
Okay. So, please perform these 3 approaches. Subscapularis. But I can take it like this. Now I have the muscle. Here are the ribs. I take hold the package, and then I see it makes plop. This is latissimus dorsi. Now it's just skin.
네, 이거 아까 했던 그 어퍼트랩 할 때랑 마찬가지인데 일단 이 거대한 근육, 인간 몸 중에서 가장 큰 근육을 치료하기 위해서 일단 포스처를 잘 만드는 게 중요하고 여기서 아까 퉁 튕기면은 그 튕긴 이후에 잡혀 있는 거는 그냥 피부고요. 그 밑에 이제 라티스버스 돌리가 있습니다. 그리고 이 표현에 약간 그게 헷갈릴 수 있는데 선생님께서 앙글로스 하는 게 이제 어깨 스캐폴라라고 생각을 하시면 돼요.
So first portion is this part. I can lift here.
Yeah, you can keep going.
Okay. And you see I fix and then I can test this part. Yes, there was a local twitch. Does it hurt?
아픈가요?
You know the pain?
아는 괜찮아요. 전에 알고 있다.
No familiar. Okay. Then I go here. I continue. And so step by step I go covering.
그래서 천천히 꼬리 쪽으로 가는 겁니다.
Here.
여기는
No pain. Here. And you go as far as possible. It's very different. For some persons you arrive just here, other you can just take it here. And you go as far as possible. And when you can't take it anymore like this, you go with the arm in this position. And you press with the hand to the leg.
눌러주면 돼요.
Yes. And then you can feel the board of the latissimus and release, and you press again.
다시 누르고
And so you can feel the border of the latissimus, and you release, and you press again, and you release, you press again, and you see I can reach up to the crest.
아까 힙은 포지션에서 이렇게 따라가다가 더 이상 내가 찾기 힘들면은 이런 식으로 수축을 시키면은 더 따라갈 수가 있어요.
Okay. But it's very seldom to find trigger points here. Most trigger points are here in this part. This is most important. And there are patients you can't reach to take the muscle like this.
여기서 이제 문제점이 발견되는 경우는 드물고 보통은 여기가 있습니다. 근데 이제 여기는 저희가 힘을 주거나 안 시켜도 쉽게 잡을 수가 있는 곳이죠.
It's preferable if you can reach it like this, but if it's not possible, it's no problem.
결국에 이제 여러분들이 이렇게 딱 하면은 바로 잡을 수 있을 건데 이게 아마 그냥 문제가 되진 않을 겁니다. 이렇게 잡는 과정이 있어서.
Okay. If you can't reach to take the muscle like this, you go in pre-stretch in this position, and then
근데 여기서도 못 잡겠으면 이렇게 만들고
you are looking for the fibers
근선율을
like
찾아가는
this.
겁니다. 이런 식으로 통통 튕기는 것도 볼 겁니다.
This works very well too. But if you press like this, you aren't sure is this really the teres major or is a muscle, an intercostal muscle, which lays under the teres major.
여기 이제 테레스 마이너나 갈비 사이근하고도 이제 분간할 또 좋은 포지션이라고 합니다.
Yeah, under the latissimus dorsi.
지금 프레 팔페이션 하는 거예요. 프레 팔페이션으로.
Yes.
이거 치료가 아니고요.
Okay. You see, if I can reach to take the muscle like this, I perform it. But there will be a part which I can't take it anymore by pincer grip. So it's no problem. Then I release and I go in this pre-stretch. In the pre-stretch, it's important to make flexion and abduction, but also an elevation and an anteversion of the scapula to reach these fibers here. And if they are pre-stretched and you go perpendicular to the fibers, you see here very well the twitching, plop, plop, and you can identify the fibers like this very easily because it's pre-stretched. Okay. I follow the ribs and I press the muscle against the ribs because it's hard, then I can feel those fibers better.
이렇게 하는 포지션 말고도 여기 섬유를 만질 때는 이런 식의 포지션도 괜찮은데 여기 섬유까지 느끼게 하려면 여기서 엘리베이션까지 이렇게 넣으면 여기 섬유도 이렇게 쉽게 만질 수가 있다고 합니다.
And then I find these fibers here. You see, this is not very often, but you can see these fibers.
트위치 반응도 확인을 할 수가 있고.
And you are looking again for the spot tenderness.
그리고 합통점을 찾습니다.
And then to pain recognition.
통증을 다시 유발시켜서.
Okay. So this is second part. This part, fascia thoracolumbalis, we will perform the fifth day. So we have today first part here.
여기 있는 아까 말했던 그 근막 부분은 다섯 번째 날에 할 거고요. 오늘은 여기 할 겁니다.
Second part here, and then third part is the part like this. Cranial from the angulus inferior. We have here just the latissimus, and then we follow this latissimus, and if I go here, which muscle I join here?
여기 어떤 근육이 있죠?
Teres major. Teres major.
메이저 맞습니다.
if you want to separate latissimus from teres major, in this position often it doesn't work very well. So I don't continue as I on your front side, please. It's okay also like this. It can be the front side or the back side. It's equal. And if I go in this position, it's much easier to find the muscle. I have here inside the teres major, then I feel block, a space, and then the lateral part is the latissimus dorsi. Please press here. Yes, internal rotation. Then you can feel it very well and release. So I perform it in this back position or on front side plank, please.
엎드려 보십시오.
Or in this side. Please press here and release. You can see it very easily. This is latissimus. Press again. And here we have the teres major, so you can follow these muscles. Okay. Last part is to make the technique 3 with pre-stretch. In prone position. Or you turn on the right side. Yes. Or also in this side, it's very comfortable to perform this technique 3. And here you can see if I want more pre-stretch, I make elevation and diversion 2, and now I have more pre-stretch to treat the latissimus dorsi. It's okay? Okay. So please start by identification. This part, first part, then in pre-stretch these fibers, and then you take this part.
자, 먼저 여기 찾고 그 다음에 또 힘주는 방법을 여기까지 찾는 것까지 하고 이제 파트 1, 2 하고 요 프리 스트레칭과 함께 기법 3 하는 것까지 해보도록 하겠습니다.
I shift the muscle in the front side and then I come from the back side on the muscle. Okay. This is one side. Second side is near the insertion point. This is the area where everyone treats the levator, and this is very important. Please continue with this. And there are 2 access to this region. One is you go through the levator, through the trapezius, you can feel the levator, and this is very comfortable to treat the muscle in this position.
이 트라페지우스를 통해서 치료를 진행을 한다는 의미고.
Okay. Often you feel the muscle if you make this fascia technique, technique 3 for the trapezius. You feel it makes blum blum, and this is normal. This is the levator, and so you can here find the levator very easily. Here is what, wop, wop, wop. Then I know it is here, and I can provoke the levator through the trapezius. If now the pain arises, the patient is familiar, I don't know, is it trapezius or is it levator? No problem, I can treat it, and I can differentiate how is it if I take the trapezius isolated alone like this, and then you can make a decision. It's levator or it's trapezius. Okay.
이 과정에서 우리가 클리니컬 리즈닝을 할 때 이게 트라페지우스 통해서 치료하는 거기 때문에 트라페지우스에 대한 문제인지 아닌지 판별하기 위해서는 우리가 계속 이제 어제도 했었죠. 반대로 이게 레베토 스케폴라라고 생각을 하고 우리가 접근을 하고 아는 통증이냐 물어보고 트라페지우스에 대한 그리고 포인트 프레셔를 누르고 역시 비슷한 통증이냐 물어보고 이런 식으로 판별을 할 수가 있습니다.
And then is there also the possibility to treat the muscle on its whole length? And for this, we repeat what we made yesterday. We reached yesterday this the superior angle of the scapula, and then we went on the supraspinatus yesterday. And today we have here the levator, and if I go, here is the trapezius, I go under the trapezius to the angle, and then I will reach here the levator scapulae. Okay?
Yeah.
We will have a look.
오늘 바쁘네 그리.
I take massage milk for the skin, not to hurt it too much, and then it's the start position is the same as yesterday. We lift, we go to the ear with the scapula and down with the right hand acromion, and so we feel on the anterior board of the upper trapezius. Where do I feel the angulus superior angle of the scapula? Yesterday we went laterally, but today we go medially. And to optimize this approach, you can now make a rotation of the scapula. I make a rotation in this sense. Here I have the angulus inferior. I can push in this direction, and here I push down, and like this it arises a rotation. So I'm on the angulus superior, and now I make this rotation, and so I can easily reach the medial border of the scapula. So I perform a technique 4 between upper trapezius and levator. I'm here on the insertion side, and I can reach now the medial border of the scapula for 1 or 2 centimeters.
어제 스프라스파이나투스 우리가 연습할 때 이렇게
You can explain here. I show it.
스케폴라를 엘리베이션 시켜서 여기서 어퍼 트라페지우스의 경계면 앞쪽 경계면을 만지고 어제는 앞쪽으로 손가락을 이렇게 컨택을 했습니다. 오늘 같은 경우에는 손가락은 안쪽으로 들어갈 거고요. 그때 이제 그냥 엘리베이션 시키는 게 아니고 이쪽 손을 이용해서 여기는 이쪽으로, 이쪽 손은 바깥쪽으로 해서 다운로드 로테이션을 시킨 상태로 진행을 하는 겁니다.
Okay. And so I can treat the insertion site directly.
그래서 이제 근육이 붙어 있는 곳을 직접적으로 치료를 할 수 있고 기법 4번을 이용해 가지고 이제 세퍼레이션을 어디서 하느냐, 어퍼 트라페지우스 앞쪽 경계하고 오늘은 레베토 스케폴라.
Yes. And then I can follow the muscle cranially, and so I can reach each part of the muscle directly.
그래서 머리 쪽으로 천천히 이렇게 손가락을 팔페이션 하면서 프레셔를 하면서 직접적으로 근섬유들을 다 컨택을 할 수가 있는 겁니다.
Okay. And to finish, we will finish with technique 3.
아직 끝난 거 아닙니다.
Friendly.
그 피니시가 아니고 방금 한 게
We have to
피니시가
finish the treatment with a gesture of friendliness.
됩니다. 이렇게 있고 그래서 4번 하고 나서 이런 식으로 3번을 적용할 수가 있다.
Okay. So please practice.
자 이제 리얼 피니시.
Produce is here, and the muscle goes behind. Here you can see it very well. So please go back again.
다시
Down again. And please make this first to examine where is the muscle. It's very easy.
처음에는
And
요
then
검사로 근육을
you
돌리면서
turn in the middle position.
자, 가운데로 보시고
And first I take the muscle as whole, both parts, the superficial and the deep part, and I look, can I take the muscle with a pincer grip? Pincer grip means I go around the muscle. Okay.
자, 이게 처음에는 전체 근육을 다 잡을 겁니다. 표층 심층부 다
It looks a
잡을
little
거고.
bit strange, but you say stop if it's too much.
요 핀치 그립으로 잡을 건데 핀치 그립이란 뜻은 근육이 요 사이에 다 들어가는 형태, 원기둥 잡는 것처럼.
And you try to lift the muscle away from the scaleni, which are behind.
목갈비근에서 이제 목비근을 떼어내는 과정이고요.
And then you go in the caudal direction, in the cranial direction,
그래서 머리 쪽, 아래쪽으로도 한번 움직여보고.
and it's different. Sometimes you take just the anterior part of the sternocleidomastoideus. You separate these two parts in the lower part of the sternocleidomastoideus.
그래서 목비근의 앞쪽 섬유, 그다음에 뒤쪽 섬유, 표층 심층 나눠서 잡을 수도 있습니다.
Often it's not possible to perform this, then you take both together. It's different.
그래서 이게 되는 경우도 있고 안 되는 경우도 있습니다.
And then you are looking for taut bands.
그리고 타우트 밴드 찾고
You can make it like this, and you see it jumps. This is not very comfortable, and it's normal that there are bands, fiber bundles you can feel.
그래서 이 타우트 밴드를 찾는 과정에서 너무 아파가지고 점핑 사인이 나타나는 경우도 있고요.
So it's very difficult to distinguish is it a taut band or it's a normal fiber bundle.
그래서 여기서는 이제 타우트 밴드인지 아닌지 구별하는 게 조금 어려울 수 있습니다.
And the bundles, they jump every time. It's very difficult to fix them.
그래서 요 딱 근육을 만졌을 때 막 콩캉콩캉 막 이렇게 근육이 막 뛰어오르는 듯한 사인이 나타날 수가 있는데 요게 계속되는 경우에는 아무래도 이제 타우트 밴드를 찾는 게 힘든 상황인 거죠.
And therefore it's very difficult to find these taut bands in the sternocleidomastoid.
그게 이제 요 지금 하고 있는 목비근에서 타우트 밴드를 찾기 힘든 이유 중에 하나죠.
So I have changed the approach. I don't palpate anymore the taut bands. It takes too much time. It's not very efficient.
그런 경우에는 이제 타우트 밴드를 찾는 시도를 중단을 합니다. 이거를 계속 오래 하고 있는 건 별로 좋은 게 아니라서.
And what I perform now is this technique we showed at the supraspinatus. I make a technique 3 diagnostically. I keep now the sternocleidomastoideus with a piercing grip. This is a technique 4, and I make a little pre-stretch of the muscle. It's okay? Yeah. And then with the other hand, I go and I glide here with the technique 3. This is very, very efficient. So I just have a treatment, and during the course of this movement, I can ask, where does it hurt most?
어디가 제일 아픈지 물어보면서 이렇게 3 기법을 적용을 하는 겁니다.
I need a little bit more of this cream. And I have to decide if I want to have a little more space, if the muscle is not tensed, I make a lateral flexion in this side. If I want more stretched, I go in the other side. You can try to optimize the situation. So
여러 가지 상황에서 이 만약에 잘 안 만져지고 이러면은 이런 식으로 점점 스트레칭 포지션을 가져가면서 공간을 만들어서 잡을 수가 있습니다. 근데 여기서 말하는 거는 스트레칭 포지션이 근육 포지션, 근육 스트레칭 우리가 아는 건 아니고요.
it's okay for you?
Yeah.
Yeah. It's equal in each part.
다 같은 느낌으로 아프거나 같은 느낌인가요? 전부 다?
점점 올라갈수록 조금 더 아프고요.
You can feel that there is more and more of the side.
하고 올라갈수록 좀 이쪽 오른쪽 쪽에
오.
좀 두터.
There was just
Yeah.
an irradiation. Okay.
한국어 잘하시는데. You're well as you're good at Korean.
Yeah.
Sounds right.
I'm good in very international languages without fixing in a culture or context. To read the body language, I'm very trained. Yes.
그래서 국제적으로 땡기면서 언어도 그런데 바디랭귀지 또한 또 이렇게 올라갔다고.
But so, please say now or here if we arrive at
So-
site.
요의 느낌이 다시 오면은 그때 바로 지금 느껴진다 뭐 이런 식으로 말해달라고.
I go further. Now? Okay. Perfect. And you see, like this, I find the sites which are more sensitive and the sites where I can reproduce the problems. I find active trigger points.
그래서 어디에서 트리거 포인트를 자극하는지에 따라서 이 사람이 어디서 과민화가 많이 일어나 있는지 확인을 할 수가 있습니다.
It's okay?
괜찮아요?
조금 어지러운 거 조금 있는 것 같아요.
Like it's a little bit disease. Disease in
This is also. Does it go away?
없어지나요?
네 지금
Okay.
Yes.
It arises again?
다시 발현되나요?
살짝 좀.
Yeah, a little bit.
Okay. So I have an active trigger point, and the treatment now could be, please turn the head a little bit in this direction, and then to the right side, to the left side. to the
이렇게 조금 돌아갈 때 조금 더 심해지는 것 같아요.
이쪽으로.
네,
이쪽으로. He can feel the more serious pain when he turn left.
Exactly, and then you come back to the right side,
다시 오른쪽으로 돌아오시고 오른쪽으로.
and then to the left side again,
네, 조금 더.
and then to the right side again, and to the left side again. Okay, and without pressure, if you turn to the left,
이쪽으로
No.
왼쪽으로 압력 없이
you
한번
have the
돌려보고요.
same pain now
같은
at
통증이
the
있나요?
head.
지금은 차이가 없어요.
It's not anymore. So I know it's not from the movement, it's from the pressure. This I have to see each time again. Okay.
자 이제 지금은 이제 움직임과는 관련 없고 압력에 의해서 증상이 발현된다는 걸 알았고 다시
Pain
반복하는
recognitioning?
겁니다. 통증 느껴지나요?
Yes or no?
네.
Yeah, okay. So if I move like this,
이렇게 움직이면 어떤가요?
위로 올릴 때 조금 더.
which technique?
요 기법 뭐죠?
2A. And this before was 2B.
이거는 움직임과 하는 건 2B.
Okay. If I stay now in this point, this is
요거는 딱 머물면은
1. Okay. Now, if you lift your head a little bit, that the pressure to the cushion is little, just 1 kilo.
한 1kg 정도로 살짝 눌러볼까요? 베개를 머리로
You lift 1 kilo your head,
다시
More?
들어 올리고
more, yes, and you go down,
다시 내려
and a little up,
반복하는
more,
겁니다. 더 올리고
yes, and down.
내리고
Now, I tired with this hand, I have to change.
자 이제 손가락이 오랫동안 눌러서 피곤하죠? 그럼 바꿔주고
And you lift a little bit
다시 들어 올리고
and down.
네.
This is what kind of technique?
자 이거 뭐죠?
2B. We will see. What kind of activation I have in this situation? Please lift a little bit.
다시 들어 올리고
Is it dynamic concentric, eccentric, or a isometric contraction of the muscle?
이거 뭐죠? 어떤 움직임을 지금 어떤 수축 형태를 다이나믹
Concentric.
다이나믹 컨센트릭 right?
Okay, lift a little bit and down. Does this and this point Please lift again.
다시 들어올려.
Does the distance between these 2 points changes or does it not change?
이거 바뀌나 안 바뀌나요? 여러분들이 봤을 때 이 포인트가
You lift a little bit
여기 집중해서 보시면
Stop.
됩니다. 뭔가 변화가 있는지.
and down. More or less not. It rests equal. You can lift, just it's difficult to explain in English. You can make lighter the pressure of to the cushion for 500 grams.
500 grams.
Grams.
Push down the pillow.
No,
Lift up.
lift that the pressure of the head to the pillow is 500 gram less.
생각했을 때 500g보다 더 적은 아까 1kg라고 생각을 했다라면은 이번에 500g 그거 반만큼 힘으로 들어 올리는 겁니다.
Yes, perfect, perfect. And now down again.
다시
Next time 400 grams.
이번 좀 더 약하게.
Once again. Yes, perfect.
그러니까 아마 지금 우리가 아까 로컬 스테빌라이저가 활성화가 안 되면은 얘네
No,
같은
no interpretation.
아, 네.
I didn't spoke about core stabilization. This is your idea. It's not my idea.
요거는 망고 네 생각이다.
Yeah. It's not an interpreter. You have to be translator, please. You're right, but it's not the focus on this way.
맞는데 지금 하는
The
건 아니다.
focus now is how can I inform the patient to perform an isometric activation of the sternocleidomastoideus. This is the task now. Please.
목비근의 아이소메트릭 운동을 지금 확인하는 겁니다.
Okay. So please, easier for 400 grams. 400. And then you see it's isometric contraction. There is no movement. Okay. And if the muscle works in an isometric way, there is no mobility. It doesn't perform like this. And we said for technique 2, we have to move like this to A or to B. So if there is an isometric contraction, it's not a technique 2. It's a technique 1. 1B. This means I press with 1A, I press more or less or more or less. 2B means I press and with this isometric activation I generate more pressure and in releasing there is less pressure and then I generate more pressure and less pressure, but it rests on the same side, so it's a technique 1, 1B.
다 이해하셨나요? 자,
Questions? Very good. International language.
등장성 수축과 함께 이제 프레셔를 유지하고 있는 거 그게 1B입니다.
And I have to explore together with the patient how much does he have to lift the head. Not whole weight, it's too much because then I have a movement. It's just a little bit. And so it's very comfortable to say first half a kilo or 100 grams, and it doesn't matter is it just or not. But if I want less, I say if I started with 500 grams, please lift 400 grams. And so I can adjust the intensity of the muscle activation.
일단은 환자한테 그냥 들어올리라고 하면은 아이소메트릭이 아니고 너무 강하게 수축하는 경우가 많고, 그다음에 환자마다 다르지만은 결국에는 뭐 1kg에서 내가 느꼈을 때 나는 좀 더 아이소메트릭 끌어올리려고 맞췄으면 좋겠다 하면은 더 약하게보다는 조금 생각하기 쉽게 만들려면은 거기서 아까 1kg였다면은 이번엔 500 해보세요, 400 해보세요, 300 해보세요, 이런 식으로 할 수가 있습니다.
Exactly. And so this is an excellent coordination training. And you had right. I activate at the same time the core stabilizers, and this is a good task.
요 다음에 이제 어떤 인지 운동이 들어가는데 그때 아까 제가 설명했던 개념을 이용해가지고 한다.
It's a side effect which is welcome on this treatment.
그리고 요 운동을 하면서 이제 사이드 이펙트가 발현될 수도 있다고 합니다.
But the focus is not to make a training for the core stabilizers. The focus is to just activate in an isometric way the sternocleidomastoideus.
그리고 이제 여기서 이제 하는 거는 어쨌든 지금 방금 보여드린 거는 다시 말해서 제가 생각해도 그 로컬 스테빌라이저에 대한 활성화보다는 요 400g, 500g 요거 한 개는 아이소메트릭을 활성화시킨다는 거.
And then I can go here also to the insertion side here. Please lift again your head. And you can see the muscle goes here behind. Okay, so please down with the head. And usually I turn the head then in this position. You can't see much, but it's very comfortable to treat because the weight of the head pushes on my finger, and so I don't have to make a lot of things. But I can examine in this position,
환자 머리 보기 때문에 바로 보고 있는 상태에서 내 손가락에 부하가 너무 많이 들어가서 치료가 힘드니까 이렇게 돌려놓는 겁니다.
You know this pain?
알던 통증.
Okay. And for treatment, I would turn like this. And now the weight of the head makes the pressure. I just have to hold. It's very comfortable.
방금 이제 검사 과정에서는
I'm just
손가락에
here, and
부하가
the weight
있으니까
of the
돌리고
head make the pressure.
치료를 해서 압력이 필요할 때는 이제 반대로 머리 무게를 이용하고.
I can perform like this, or I can perform by pressure like this.
여기서 내 힘으로 누를 수도 있고 머리 무게를 이용해서 방금처럼 할 수도 있고.
Okay. The separation technique we performed as first, and now the fascia stretching.
그래서 분리 기법 먼저 사용하고 이제 근막 스트레칭 기법 사용을 합니다.
It's okay? Okay. So please start with the sternocleidomastoideus and try once this technique 1B to perform this 1B.
자, 연습 시작하고 1B 아까 한 거 한번 그것도 시도해 주세요.
I start every time with the palpation of the sternocleidomastoideus.
항상 만질 때는 목빗근부터 시작을 합니다.
Please turn the head to the left and lift the head. We see superficial part, and this is the deeper part of the SCM. So please down with the head, and we start the palpation for the scalene muscles laterally from the deep part of the sternocleidomastoideus.
자, 가쪽에서부터 안쪽의 깊은 곳까지 들어가겠습니다.
Please turn back in the middle position, and then I push here to the lateral part of the neck, and I feel it's the same as if I press here to feel the thorax and the ribs.
요 몸통에서 우리가 그 갈비를 만지려고 노력하는 거죠. 그것처럼 비슷하게 여기서도 가쪽에서 안쪽으로 들어간다고 생각하시면은 됩니다.
And that what hinders that I can go further and further and further. This structure which I can feel, these are scalene.
그래서 만지다 보면은 뭔가 구조물들이 겹겹이 이렇게 만져질 건데 그게 이제 스칼렛 머슬입니다.
Those scalene are tough. They are straight. They are not. They don't make blop blop. They have to protect the internal organs of the neck region, and so they are, tough. I don't know. It's okay in English to say it's tough.
그러니까 이게 하다가 너무
There is a certain tension in this muscle to protect the inner organs.
그러니까 목 내부 깊이 있는 조직들을 보호하기 위해서 애초에 이 머슬들이 굉장히 터프하고 그러니까 되게 거친 상태로 유지가 되어 있습니다. 그래가지고 이게 이제 그 어떤 이 사람이 긴장을 해서 스탑 사인으로 나타나는 게 아니고 애초에 터프할 수도 있기 때문에 이 치료를 할 때는 버발로 꼭 너무 아프면 말하라고 하는 게 좋다고 합니다.
Okay, and making so, I can feel fiber directions in this direction, and so I explore. Okay, here I feel a bundle of fibers, here another bundle, and in between, it's like between two fingers. This is probably this hiatus.
근육결이 이렇게 지나가니까 우리가 수직으로 이렇게 찾을 수가 있다는 내용입니다.
And if I think it could be here in this region, then I say, please breathe deeply. More. And then I feel a contraction in the muscle.
그래서 아까 말씀
Please
강제
breathe
흡기를
normally.
할 때 활성화되니까 수축을 느낄 수가
And
있습니다.
often this hiatus opens a little bit because if there is a tension, then you can feel better the space between the two parts.
그래서 종종 여기 사이 공간이 이렇게 벌어지는 것도 볼 수가 있습니다. 갈비 제일 위쪽에서.
And so I have a confirmation through the activation of the muscle I'm on the right structure. Please again, breathe deep.
그래서 이런 흡기를 할 때 뭔가 수축이 느껴지면 내가 잘 찾았다는 거죠.
Okay. And so I'm sure I'm on the anterior part of the scalene muscles, and I follow here to the transverse processes of the cervical spine.
네, 앞쪽 앞목갈비 이거는 확실히 찾은 딱 그 확신이 생기면은 위쪽으로 결을 따라서 이제 가로돌기 쪽으로 할 수
Okay.
있습니다.
And first I perform an overview examination on all three parts of the muscle to see where is it more sensitive.
네, 이제 목갈비 근이 세 가지 섬유로 나뉘는데 각자 그 중에 어떤 섬유가 문제인지 보기 위해서 오버뷰 이그제미네이션을 지금부터 할 겁니다.
Yeah. You see there are sensitive parts. Does it hurt?
Yeah.
Yes.
That
It
hurt.
rests local or does it go where?
Hurt.
Refer. You know this in the arm?
Yeah.
Yes.
Sometimes.
And if I don't press anymore,
Yeah.
it's still there or it goes away?
Goes away.
Fast or slow?
Fast.
Fast. So here it could also be a nerve irritation if I press close to the plexus. But if the symptom goes fast away, can it be a nerval provocation or not?
이렇게 통증이 빨리 이제 내 압력에 따라서 없어지고 생기고 하면은 널브 문제라고 생각할 수 있는지 없는지 물어본 겁니다. 우리 생각에.
이렇게 이렇게
It can be, you think? It cannot be. Why? Because I have to know the pathophysiology of the entrapment neuropathy. This we will discuss profoundly in the part 2 of the course. But if you press on the nerve slowly and you have less perfusion in the nerve, and then it gets with the time a malfunction of the nerve, metabolic block. And if you release, this takes time to get the circulation again, and so it takes time to recover the problem, and so the symptom will go back after several seconds, but not immediate. And so it's very practical to distinguish these two things, and if it goes away very quickly, it can't be a nerval problem. This is very helpful to distinguish.
경태생리학적으로 요거를 나중에 또 파트 2에서 다루기는 할 건데, 일단은 결론적으로 이렇게 증상이 빨리 없어지거나 생기거나 하면은 신경 문제는 아니라고 합니다. 그래서 우리는 요거를 필수적으로 좀 구분을 할 줄 알아야 된다고 얘기를 했습니다.
Second point. I rest on the point without movement, without doing anything. And we observe what is the reaction. Get it worse or better?
Now it's better.
Now it's better. If I press continuously on a nerve, what would happen? Worse and worse and worse. It wouldn't be happy because the problem would accelerate. So I have now two signs, and both signs indicates very clear I don't provoke now a nerve structure.
그래, 아까 얘기한 게 이제 첫 번째고, 두 번째 같은 경우에는 이제 로랜드가 같은 압력을 움직임 없이 계속 적용을 할 때, 만약에 내가 신경 문제에 대해서 신경을 같은 압력으로 움직임 없이 누르고 있으면은 이 증상은 계속 나빠져야 됩니다. 계속 누르고 있을수록.
Okay.
그 두 가지 기준.
So if the problem would rise more and more and more, please stop to press.
증상이 악화되면은
It would be a nerve, and to irritate the nerve is not a good idea. It doesn't work. Please don't do it.
계속 같은 내용이죠. 그래서
오케이.
만약에 신경 문제다 그러면은 지금은 알지만 반대로 신경 문제라고 판단되면은 바로 그만두시면 되겠죠.
Yes. But if it's a muscle, a trigger point, it's best way to release it, to stay on the point and to continue.
하지만 지금처럼 이제 근육 안에 있는 트리거 포인트 문제라면은 압력을 계속 넣는 게 좋은 거죠.
Okay. How do you feel now?
Local pain?
Local pain and in the arm?
No.
No pain anymore. So it's clear. Okay. Then I go to the medial scalene. I go laterally.
Oh.
이게 가쪽으로 더 가서 중간
Overview provocation.
Oh.
Here most sensitive. Taut bands I can feel very well. It hurts.
Yeah.
Local.
Local.
You know this pain?
Sometimes.
Sometimes. So. Okay. And then I go to the scalene, to the posterior scalene.
이제 뒤쪽 뒤 목갈비 있던 데로 갈 겁니다.
Most often I can't feel the border between the medium and the posterior scalene, so I go in a different way.
중간 목갈비근하고 뒤 목갈비근의 경계를 느낄 수가 있는데 이때는 이제 다른 방식으로.
Which structures lie behind the scalenus posterior?
스칼리니우스 포스테리어 뒤쪽에 어떤 구조물이죠?
Huh? Also, but direct after behind the scalene doesn't lie this scalene. It does lie the.
Upper trapeze.
Okay, we have to look. I have to take another picture.
사진 보여드릴 겁니다. 이제 스플레니우스도 맞는데 로렌드가 원한 거는 바로 진짜 뒤쪽에 어떤 게 있는가 사진으로. 여기 잘 나와 있습니다.
We have started here. SCM,
Rebate.
deeper part. Then we arrive at the anterior scalene. Here is the hiatus. Then middle scalene. Here is the posterior, and behind the scalenes we are on the levator. And after the levator, there is venous cervices and capitals. Okay. So, if I want to get the posterior scalene, I go on the levator and I go anteriorly from the levator, and I must be on the scalene. Okay? So it's a very good thing to identify the levator scapulae also in supine position. We know angulus superior with my right hand. Then I go to transverse processus C1 here. I know the muscle have this way. Huh? I go to the trapezius, anterior border, and I know here must come the buck. This is levator. So it's very comfortable to palpate the levator in this position.
레베토 스캐플라를 찾을 수 있으면은 반대로 그 레베토 스캐플라 앞에 있는 게 우리 스칼렌 머슬들이니까 되게 레베토 스캐플라 찾는 게 좋은 방법이고 방금 보여준 방식이 이 자세에서 레베토 찾기 제일 쉬운 방법 중에 하나라고.
I can treat the levator perfectly in this position. But now I use the levator for orientation reasons, and I go in the anterior part. You see, back now I'm anterior of the levator, and if I press now here to the neck, I'm on the scalenus posterior scalene. Okay. Here I change my finger
손가락 모양
because
바꾸고요.
if I take my thumb like this, I can push the levator here a little bit away and I can reach very deeply in this region of the scalenus posterior. The scalenus posterior reaches the second rib, so I can feel the first rib and it goes deeper than the first rib.
자, 스칼레니무스 포스테리어 같은 경우에는 두 번째 갈비 정도로 깊이 있으니까 손가락 모양을 이제 엄지로 바꿔가지고 쭉 누른다는 뜻입니다.
Does it hurt here? A little bit. Local or does it hurt local? Local. Because this is the site where most often it refers to the medial border of the scapula. I will have a look very precisely. How is it here?
여기 어떤가요?
Local.
Local.
Medial border.
Yes. 80% most often. You too. So I have to look for millimeter for millimeter. You have to be very, very precise if you want to arrive these points. You know this pain?
Yeah.
Great. And then you turn a little bit to this side, a little bit to the other side. Which technique I perform? 2B. 2B. There is a motion, and I perform with rotation. I know scalene would be perfectly with lateral flexion, but it doesn't work, and with rotation it works very well. So I do what works in everyday practice.
그래서
You continue, please.
여기 자기도 이게 처음에 많이 연습을 했던 이유가 이렇게 움직임으로 뭐 근육 지금 만지고 있는 스칼레니우스 근육을 확인할 수도 있지만 우리가 알다시피 가쪽 굽힘이나 회전을 하는 근육들이 굉장히 많습니다. 그래서 그거를 구분하기 위해서 자기도 이 부분에 대해서는 많이 연습이 필요했었다고 했고요.
Slowly, slowly, slowly. One direction. Yes. Does it remain or does it change? At the middle border? More or less? Yes. A good sign. So we make the treatment. Okay. Yes. The facial separation technique we performed now between levator and posterior scalene, and the separation technique here to the SCM we performed before and when we go here. So this is enough, and we will perform now this technique 3 again. We start in the middle position, and then you can turn slowly, 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 slowly. Yes.
자, 방금 적용한 4번 기법 같은 경우에는 뒤 목갈비근하고 레베토 스캐플라하고 분리하는 기법이었습니다. 그리고 지금 3번이고.
Yes. Okay. So please, you start with sternum. You go, please lift, and the lateral border onto the scalenus anterior scalene and down. You are looking for this hiatus. Then deep breathing to identify the muscle. Okay. And then you go to the medial part. Then you go to the dorsal part of the scalene muscles, and you identify the levator, and you go in front side of the levator. I propose you change your partner, then you have another tissue if you identify again this SCM muscle.
자, 이제 실습을 시작을 할 건데 첫 번째는 SCM을 찾는 걸로 시작을 합니다. 그리고 SCM 가쪽에서 앞목갈비근을 찾고 앞목갈비근을 찾은 상태에서 강제 흡기를 시켜가지고 수축을 확인하고요. 그 다음에 중간 목갈비근, 그 다음에 뒷목갈비근이랑 레베토 사이를 분리를 하고, 그리고 실습 충분히 했으면은 다 다른 구조물들이 다 다르니까 파트너 맨날 하던 사람 말고 또 바꿔보는 것도 좋은 방법이라고 하셨습니다.
On the left or right side?
고민이
Right side, so turn on your left.
컨셉.
Oh,
아니 쌤 말이 쌤.
So, origin and insertions we know come here from the thorax, from the ribs 1 to 9, and it goes to the angulus superior, to the middle border, to the angulus inferior of the scapula. And if you see this, it's a very, very large muscle. Very, a long muscle.
기시점들을 잘 살펴보면은 생각하는 것보다 요 정도 사이기 때문에 굉장히 넓은 근육입니다.
We have a little problem.
Had a little problem.
We have a little problem.
요거는 조금 문제가 될 수가 있는데.
Which one? Here is the scapula and the latissimus, and you see I can touch it directly just in a very small part, and here I have a problem.
그래서 스캐폴라랑 라티스모스가 덮고 있기 때문에 이걸 직접적으로 만질 수 없는
So
문제가 있고요.
I have to deal with this problem. I have to understand it. When I press here, I'm not on the serratus anterior, I'm on the scapula. So first thing is to realize the dimension of the muscle, and then please come back with your hand here. Yes. And when I go now back with the shoulder, you see I can dissolve a part of this problem. By moving back, this area where I can reach the muscle directly is much bigger than if the shoulder is in protraction. So first thing is to make the retraction of the shoulder. Then I have more access. This is one benefit. And the second benefit is
여기 서 있어.
the muscle. If you go back with the shoulder, the muscle is stretched. And in the stretched muscle, it's much more easier to find taut bands than when the muscle is not stretched. So you have two benefits if you go back. And then we go perpendicular to the taut bands, and we are looking, do we find fibers here, for example?
이 포지션을 하면 이게 두 가지 이점이 있습니다. 아까 가려져 있던 부분이 치울 수가 있고 스트레칭 되니까 좀 더 쉽게 만지고.
Okay. And making this exploration, I feel it is a sportsman, it's an athletic, it's a climber, or it's a person which doesn't often use the serratus. The serratus is very, very different. Sometimes it's very easy to feel it, and sometimes you think there is no serratus anterior, or little serratus. But here I have fibers. It's okay? Okay.
세라투스 안테리오 같은 경우에는 운동 선수처럼 혹은 운동 엄청 많이 하는 사람들 아니면은 굉장히 찾기가 힘들다고 합니다. 거의 세라투스 안테리오가 없나 생각이 들 정도로.
Okay. So here this needs time. You go slowly, step by step, and I follow first the ribs, because to press the serratus against the ribs, then you can provocate the pain. If you go in the intercostal area, it's very difficult. It's not so clear. So first you go over the ribs and you are looking, are there taut bands, are there fibers you can identify. Okay.
갈비 사이에서 뭔가 계속 누르려고
Here again I
하면
have such a fiber.
찾기가 힘들기 때문에 일단은 처음에 찾을 때는 갈비 위를 위주로 합니다.
Sorry. Snapping palpation. Here I can feel very well these fibers. Okay. This is first approach. You go back and you take the part ventral from the latissimus dorsi. Second approach is you go in front of the patient.
엎드리시면 돼요.
No, you rest. You rest.
환자 앞에서
And you go as high as possible with the leg. You use the infrastructure. It's a very good infrastructure. So please use it as high as possible. Okay.
침대 칭찬이었습니다.
And then you take body lotion. If I take body lotion, you know now I will perform technique 4.
네, 바디밀크를 쓸 건데요. 이제 알겠죠? 바디밀크를 내가 썼다는 말은 내가 4번에 쓰겠다는 뜻이라는 거죠.
I go in this position. I look, this is more or less parallel to the floor. And now I have here the latissimus. I have to look. Where is the shoulder blade? It's here. Okay, here is the latissimus. Top. And I go ventral from the shoulder blade. I take massage, body lotion. And then I pull the shoulder blade, the shoulder, over 2 or 3 fingers. My fingers are on the serratus, on the ribs, and I pull the shoulder over my fingers. And then you go back with your right, left hand, and the shoulder, with all 3 together. Right hand, shoulder, and my left hand. Then my left hand stays, and I pull the shoulder over my fingers. Okay? So I enter this subscapular gliding space. Yeah.
지금 요거 같은 경우는 어떤 느낌으로 하는 게 좋냐면 그냥 당기는 것보다는 어깨뼈 면에 잡고 왼쪽 손가락 위로 이렇게 덮는다는 느낌으로 당겨 오시면 되겠습니다. 그렇게 해서 이제 스캐폴라랑 소락스 사이의 공간을 글라이딩 시키고 있는 거고요.
Exactly. And then I go back with my right hand, left hand, and the shoulder. I rest here with my left hand, and with my right hand I pull again the shoulder over my finger. And so I enter step by step in this scapuloturbo gliding space.
그래서 아까랑 같은 내용인데, 자, 당길 때는 위로 이렇게 당기고, 갈 때는 둘 다 같이 갔다가 다시 머무르고 당기고, 갔다가 다시 머무르고 여기만 당기고 이런 식으로.
And then I move. It's a separation technique for serratus anterior and subscapularis. It's okay?
그래서 지금 서브스캐폴라리스랑 세라투스랑 분리시키고 있습니다.
I can dislocate a little bit and make the same. I go back, I pull over, and it's okay? Okay. This is the facial separation technique. If I go inside and I go down with my fingers, I will press on the serratus anterior and see how is the reaction. It's worse.
그러면서 반응 보고.
Okay. And I'm looking, is it possible to find active trigger points? If I turn my fingers like this, and I take the shoulder over my fingers, I perform also this facial separation technique. And if I make now flexion with my fingers, I will reach to which muscle?
이렇게 하면은 어떤 걸 잡을 수 있을까요?
Exactly. And you see, it's a continuation from the treatment we made yesterday for the subscapularis on the back side. On the lateral side, it's very comfortable also to perform.
어제 서브스캐폴라리스 할 때 보여줬던 거의 연장선인 기술입니다. 가쪽에서 어제 연습했던 것도 효과적일 수가 있는데 이것도 편안하게 할 수 있는 기법 중에 하나고.
So, like this for subscapularis, like this for serratus anterior, and this means the techniques we made yesterday for subscapularis, it's vice versa. You can turn the finger on when the patient lies on the back side, and then you are on the serratus.
그래서 어제 이렇게 서브스캐폴라리스 할 때 우리가 3번은 따로 이렇게 적용을 하지는 않을 어렵기 때문에 그 내용에 대해서 얘기를 하고 있습니다.
Okay, this is second part. Third part is I go to the cranial slides of the serratus. I'm now here back again. I go down with the bed. It's okay. For For me, it's very comfortable to use my body, my part here, as third hand. So I have one hand here to fix, one hand here, second hand, third hand is here, and this is my fourth hand. So I have four hands to manage this. It's very comfortable position. Because if I make like this, there is often a tension in the arm because it's not comfortable to hold in this position. So I can stabilize here. Okay. And now I take body lotion and I go here in the axilla, and step by step I go to the second, third, second, probably first rib. This looks a little bit crazy, but we will ask him.
맨 처음에 했던 거는 지금 잘 보시면은 여러분들 나중에 실습할 때도 이렇게 받치고 있는 부위를 잘 보셔야 됩니다. 여기서 하나, 여기서 둘, 여기서 셋, 넷 해가지고 이제 로 선생님 표현으로는 나는 지금 4개의 손으로 치료를 하는 것과 마찬가지다. 그래서 여러분들도 이거 나중에 연습할 때 저 포지션을 맞춰야 되고, 여기서 엄지손가락으로 컨택을 해서 들어가는데 상상을 해서 첫 번째, 두 번째, 세 번째 갈비 방향으로 깊숙하게 들어가야 됩니다.
For me this works well. If it doesn't work for you well, you can also take a cushion and put the arm in this position, but it has to be comfortable for the client, that he don't have to hold his arm, because if he has to hold the weight of the arm, I can't reach here inside.
그래서 뭐 만약에 환자가 이 자세가 너무 불편해가지고 이 자세를 만들고 싶을 때는 베개를 받치던가 끼우던가 해가지고 치료를 진행해야 되는데, 그 이유가 만약에 베개를 안 받친 상태에서 뭐 이런 식으로 환자가 자세를 만들면은 힘이 들어가가지고 이런 식으로 컨택하기가 힘들다고.
So with my thumb I feel the rib, the intercostal space, the next rib. It's okay for you. It shouldn't hurt at the moment. It looks a little bit strange, but it doesn't hurt because I don't press. I'm looking for the way with the littlest resistance.
지금 이제 눌렀을 때 안 아프다고 한 게 맞는 게, 지금 그냥 길을 찾기 위해서 그렇게 큰 저항, 큰 이렇게 압력을 넣은 게 아니기 때문이라고.
And you see with elevation, I reach more and more higher and higher here in this area.
지금 이렇게 길을 찾으면서 동시에 엘리베이션을 점점 높게 가져가고 있습니다.
When it's not possible to get further, then I rest here and I go back more again, and then there is again a stretch on the serratus by this movement back.
그래서 점점 올려가다가 이제는 뒤쪽으로 이렇게 당겨서 세라투스 안테리어가 좀 더 늘어나게.
And now I go with my finger in the direction to the angles, to the superior angle of the scapula.
이 상태에서 지금 이제 엄지 손가락은 이제 어깨뼈 윗각 방향으로 가고 있고요.
And now start the hurting part of the procedure.
이제 만졌을 때 좀 아픈 부위에 도달을 했습니다.
It's okay. And here I am looking for painful parts in this upper part of the serratus anterior.
지금 이 세라투스 안테리어의 상부에 도달을 했는데, 여기서 이제 조금 만졌을 때 아픈 포인트라고 합니다.
Okay. You see like this. In this direction I change a little bit. It's okay?
네, 조금 이렇게 방향을 바꿔가면서 이렇게 할 수 있고.
Now here it's not possible to make a technique 3. It's not enough space. But I want to release after the treatment. Another possibility would be to move like this.
지금 이제 3번을 적용을 할 수는 없지만, 그래도 내가 이완을 뭔가 하고 싶을 때는 이런 방법도.
In this position. Does it hurt?
뭔가요?
It should hurt now at all.
혹은 이런 방법도 이용을 해주고.
It should feel comfortable after the treatment to release.
치료를 해서 이렇게 이완이 되면은 편안함을 느끼고 있는 거죠 지금.
It's okay? Okay. So, please try.
자, 가봅시다.
Thank you so much. So first, I will identify the anterior border of the trapezius here. Here. This is blob. You see, it makes blob. This is just skin. This is skin and trapezius blob. There is the ventral border. And then I will identify the dorsal border of the SCM. Here is SCM, here is dorsal border, and here between it's an open space. And in this open space I can treat directly splenius capitis and splenius cervicis. Okay. To find where the muscle lies needs to get the reference points. The reference points for the splenius capitis are C4 to T3. I start to palpate C7 and then I go in the middle of C2 to C7. Here it's the middle, it's C4. Or you palpate C7, C6, C4, 5, C4. One finger rests here and then you go again to C7 and you palpate T1, T2, T3, and you know this is origin. With the other hand, you go to processus mastoid, and then you know exactly where the muscle lies. Okay. And here is covered the muscle by the trapezius, but at this part we identified before, I know where the muscle has to be. I can't feel plop, plop, it doesn't work, but I know because I have the reference points, here the muscle has to be. I can go upward to the occiput, there is no splenius capitis, and if I go back, then often you can feel here a little border. This is the border of the splenius capitis. Here I can feel it. Huh? And then I know I'm on the splenius capitis. Most trigger points are in this area, and in the upper part near the insertion side you see the SCM muscles. I can move away, there is no problem, so I can reach very near to the insertion side, and most trigger points for the headache are in this region. It's okay for you?
Yeah, okay.
Okay. Do you suffer headache?
Yeah.
Sometimes? Or
Sometimes.
Sometimes. So I will look for the connection. And you see from our 3 diagnostic criteria, first one I can't notice here. So I start where are sites which are more sensitive. It is every part same, or is it different?
세 가지 진단 기준 중에 타우토 밴드 찾기는 조금 제한점이 있는 근육이라서 어디가 제일 과민화가 돼 있는지부터 찾습니다.
It hurts?
Oh, pain.
Pain. Local pain or referred pain?
Some report. Middle report.
Referred a little bit.
Referred. A little bit. Okay. You know the area where the pain arises.
어디서? Here maybe.
Yeah. Do you know this
요
pain
안에,
from
안에
your
어떤 동작이
everyday life?
일상에서.
네, 오늘 아침에 겪었던 두통 비슷합니다.
Yeah, it's similar with the pain in this morning.
Okay. Okay. So active trigger point. So I change to the treatment. Which technique?
뭐죠 테크닉?
No.
1A. 아 2A 2A.
Does my finger move or does it not move? Please come closer.
잘 보세요.
Do you feel a movement or not?
뭐
Yeah, he
Yeah.
feels, but it's. Have a look. Is it a big or a small movement? Very small. We have to study it carefully. It's a very small movement. You can't see almost, but there is a movement. He feels it very well. very small and very slow. Then you have the fastest effect. Very little. It rests the pain or does it change?
좀 바뀌나요? 통증 양상이?
네.
Yes.
Yes, what?
어떻게 바뀌나요? 좀
레프트 페인이 지금은 없어요.
no rapid pain. Just
No,
right now.
exactly. It has changed, it has diminished. This is perfect. Okay. This is splenius capitis. Okay. Then splenius cervicis. Reference points are arises from T3 to T5. So I palpate C7, 1, 2, 3, 3, 4, 5. I know from here goes the muscle to the transverse processes C1, C2. Okay, I palpate again C1 here. You see before the mastoid process, behind here the jaw, and then I have an inner vision of this direction of the fiber. Okay, this is very important. And you see here the muscle is under the trapezius, and then at this side the muscle will come on the surface where I can palpate it directly. So I go, as we practice with the levator, I palpate first here the superficial laying trapezius, and then I change, I turn my finger to feel, is there a taut band, is there a fiber I can identify. Okay. This was for demonstration, I showed like this. In my everyday practice, I make it different. I sit on this side. I'm here. I go to the identification, C7, 1, 2, 3, 4, 5. Then I know it's here, okay. I go to this point, and then I turn my finger, I sit to be on the same level, and then I explore, can I feel here the fibers? And now I can feel here fibers, it's made click, click, click. And I am looking, are there 1 or 2 or 3 such fibers? Here I can follow a fiber. And I'm not sure, is this really splenius cervicis, or what could it be also? Exacto, levator. This I don't know at the moment, but it could be. Want you to translate a little bit? Or who needs translation?
필요하신 분 있나요 지금?
Who wishes translation? Or is it clear?
아 괜찮죠. 눈치껏.
Because if it's clear, it's perfect. Perfect. So now I can feel here fibers, and I don't know, is it splenius cervicis or levator? So to know this, I release and I go to the levator scapulae. So I make identification of the reference points of levator, angulus superior, and again C1. And you see it's more laterally. I go in this side, trapezius, I turn my finger and I'm looking, and then I feel here the muscle. Boah, and I'm surprised. It's a thick thing here. It's like the little finger. It's blong, 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 blong. And then I go in this direction, and here I feel the thin fiber, and the thin fiber makes bling, bling. Bling, bling is splenius cervicis, blong, blong is levator scapulae. Okay, and so I know now this is levator, and in the dorsal side, next thin fiber, this is splenius cervicis. And so I'm sure in combination to feel both. Okay, very good.
이제 우리가 전에 레베토 스캐플라 촉지할 때도 지금이랑 되게 비슷한 포스처와 비슷한 위치에서 했었습니다. 그래가지고 맨 처음에 이제 로 선생님 이렇게 할 때는 말씀하시기에 근데 지금 이렇게 통통 튕기는 게 있긴 있는데 지금 상황으로서는 레베토 스캐플라인지 아니면은 이제 스플레니어스 서비스인지 확인을 하기가 조금 애매합니다. 그럴 때는 이제 다시 레베토 스테플라의 인설션과 오리진 구역을 찾아가서 한 번 더 확인하고 레베토를 만지려고 한번 해보는 겁니다. 그러면은 아까 만졌던 스플레니너스 서비스에 대한 퉁퉁 튕기는 것보다 레베토에 상대적으로 더 두껍고 더 큰 튕기는 것 때문에 이제 일단 인지가 되니까 그 다음에 다시 조금 더 안쪽으로 가가지고 서비스를 만지면은 확실한 두께 차이를 느낄 수가 있어서 그 두 개를 명확하게 할 수가 있다고 합니다.
Thank you. And now I'm provoking and I'm asking, does it hurt? I know it hurts, huh? It's very international. And then I ask, do you know this pain? Kim, do you know the pain?
No.
No. There is no irradiation?
No.
No. Okay. So I go further and I'm provoking several sites on this splenius cervicis. And here?
Oh.
Oh,
No.
no, not, you don't know it.
No.
You know it?
Yeah.
Okay. It remains local or does it refer?
People.
Refer in which area? Also behind. Okay. And you see I changed probably 1.5 millimeter. It's not a big distance and you have to be very, very precise so to find these points. And then I make the treatment. Which technique? 2A again. You see very small movement. No B because if he starts to move, tack, I'm not anymore on the point. So I have to adjust and here works very well. Technique 2A. It's okay?
No.
No. So please say stop if it's too much.
너무 아프면 말씀하시고.
Okay. Good. Then the facial separation technique. I treat it now in the area where I can reach the muscle directly. Here are most often the trigger points. This is very comfortable for us. But you can go and look here in front of the trapezius. Can I make this facial separation technique? And so you can reach a part of the splenius cervicis and the splenius capitis as well, where you couldn't reach before through the trapezius. Okay. This is facial separation technique in this position. And then we make the facial stretching technique. It's okay?
Yeah. Okay.
For both muscles, splenius capitis and splenius cervicis.
여기서 두 가지 다 근육 두 개를 한꺼번에 이렇게 3번에 적용할 수가 있고 방금 얘기했던 거 마지막에 얘기했던 거는 트라페지우스가 먼저 이렇게 조금 트라페지우 위에서 간접적으로 치료를 해가지고 전체적으로 이완이 되고 나면은 그 사이에 이제 세퍼레이션 공간이 좀 더 여유 있게 나올 수가 있다는 내용이었습니다.
Okay, so please use these reference points for orientation. It's indicated on the slide.
슬라이드에 나와 있는 기준점들 두 가지 기준이 뭐였죠?
Depth of the layer and fiber direction. So before starting, I remind I have to be aware for two informations. Depth layer, and it's okay to start every time in the first layer I know trapezius. Then I remember second layer, this was splenius we performed before, and now we go to the third and the fourth layer, and I know I will not can palpate this muscle directly. I have to know where they lay. They can make a provocation, but I can't feel the muscle itself.
그래서 우리가 항상 이제 첫 번째 층에서는 이제 어퍼트랩이 있는 걸 알 수가 있습니다. 두 번째는 스플레니우스가 있는 걸 알 수 있고 지금부터는 세 번째, 네 번째를 찾아가는 과정을 가실 건데 이제 항상 바로 이렇게 만지는 것보다는 아까 말했던 기준점 두 개를 이용해 가지고
And the fiber direction I know splenius capitis, splenius cervicis, multifidi, rotatores. Huh? This I visualize. Then I know I can take here the whole package. So with this whole package, I have 3 layers. I have all muscles without the 4th level. So I know I have the trapezius, I have the splenius, but primordially I have the semispinalis, capitis and cervicis when I take it like this. Hold the package, both sides, or I can take just one side. I go between the spinous transversus and the transverse process, spinous. It's very difficult because I speak this Latin terminology.
TP나 SP를 좀 찾는 거예요.
Processus spinosus, processus transversus. It's because it changed. It's no problem. Spinous process, yes, spinous process and transverse process. And in between, you take all the package as profound as you can. You go like this, like a lion. Then you see. Okay. And this you make in different positions. You are looking what can you take like this. Okay. This is the focus of the semispinalis tract. One side or both sides. If you feel it doesn't work, sometimes you have to move ahead a little bit in this position, then it's more released, but you have less space. And if you have too little space, you move a little bit like this. You have more space, but it's more tensed, and you have to find the optimal position. You have to change a little bit. Okay. Now, if you find hotspots, you can't palpate the muscle, the taut band again. It's a provocation procedure here too. If you find hotspots, you can provocate it, and you can treat it if you have pain recognition with or without referred pain. Does it hurt? It hurts. Local or
Local.
local? Do you know it?
No.
No. So it's no trigger point. Okay. But the treatment would be like this or like this. And now you don't know is it 1st or 2nd or 3rd level. You provoke all 3 levels, then you can go again. The 1st level muscle you can reach like this. Does it hurt equal as before?
Equal.
Equal. So you know it was a problem in the trapezius. But if it's different, it hurts like this, but it's not the pain the patient is familiar with. You go again, and now he says, oh, this pain I'm familiar with, then you know it's the 3rd level. Like this you can differentiate. Okay. Now for the 4th level, there are 2 approaches. One approach is I'm between C7 and C2. One is you take here this 3rd level muscles, semispinalis, and you go dorsal of the transverse process, but ventral from the semispinalis muscle. Then you reach the dorsal part of the laminae. Okay. And there lies the rotator muscles. Okay. So the lateral part of the rotators you can reach more or less directly if you are anterior of the 3rd level muscles of the semispinalis. You got it?
자, 일단은 맨
You continue,
처음에
I hope.
일단은 먼저 3번째 층 만지는 것부터 했습니다. 그렇죠? 그때 이제 전체적으로 이렇게 확 이런 그립으로 전체 근육 첫 번째, 두 번째, 세 번째 층을 다 잡을 수는 있습니다. 그래서 여기서 자극을 주는데 만약에 아프다. 근데 제가 이게 뭐 첫 번째 층에 있는 근육이 아픈 건지 두 번째 층에 있는 근육이 아픈 건지 뭐 세 번째 층인지 모르니까 일단 여기서 한번 이제 문진을 하고 같은 현상이 일어나는지 첫 번째 층 근육만 분리를 해서 만져보고 또 같은 질문을 하는 겁니다. 그렇게 감별을 할 수가 있고 머리의 익스텐션 플렉션 포지션에 대해서는 그냥 자기가 편한 거 찾으면 된다고 합니다. 왜냐면은 지금은 공간이 좁아서 못 만질 수도 있지만은 펴면은 텐션이 너무 생겨서 못 만질 수도 있으니까 요거의 기준은 이제 사람에 따라서 다르게 할 수가 있습니다. 그다음에 네 번째 같은 경우에는 이제 로테이터를 찾아가는 게 네 번째 층이죠. 그래서 아까 세미 스파이널리스 머리 방가식을 만질 때처럼 찾은 다음에 트랜스버스 프로세스를 찾고 여기서 뒤쪽으로 가기는 합니다만은 어디까지 가느냐면은 이제 라미나까지 이 그 가시돌기 스파인 나도 헷갈려. 가시돌기 사이에 가시돌기에 있는 사이까지.
Okay. A little model. This would be the straight system, third layer muscle, semispinalis, capitis and cervicis. Okay. Third level. Above would be splenius and trapezius. If now I take these muscles and because it's long, I can move it from side to side. And if I now take this muscle and I go anteriorly of this muscle and dorsal of the transverse process, then I'm here dorsal of the lamina. And here lies the rotator muscles. So you can reach by performing such an access. You keep in the hand the semispinalis, what you can move, and you go anterior of the semispinalis and dorsal of the transverse processus, then you reach the lateral part of the rotator muscles, of the fourth layer muscle.
그러니까 이게 이렇게 있잖아요. 그래서 이제 만질 수 있고, 그 다음에 엔테레 파트 쪽으로 조금 가면 로테이트 머슬들을 만질 수 있다.
And the rotator and multifidi, they are fixed because they are short. They have to rest here. I can't move them away.
그래서 추가 설명을 드리자면은 그 방가식은 같은 경우에는 이렇게 잡고 움직일 수는 있습니다. 그래서 움직여 놓고 한 손으로 고정을 시킨 다음에 그 밑으로 해서 이제 트랜스퍼스 프로세스부터 해서 로테이터들을 확장을 하면 된다는 거죠.
The treatment is very simple. I have just to take all what I can. I go ventral from this structure. You see, this what moves is first, second, and third level, and I'm deeper than the third level, so I'm on the first level, and I feel here the transverse processes. I go dorsal from the transverse processes, but ventral from the semispinalis, and so I'm on the lateral part of the multifidi and rotators. Perfect. And it's very different how deep you reach here. It's sometimes you can't reach, and sometimes you can touch the spinous transverse, the spinous process. Thank you. Okay. It's okay. So this is a technique 4 between the third and the fourth layer, between semispinalis and rotators. And then I press ventrally to provoke the rotator. And you see it's a strong irritation. It's okay? It's okay? It's too much? Do you know this pain?
Yes.
You know it?
Yes.
Oh, great. For the therapy. So this would be a movement. Technique 2A. Okay. This is for the lateral part of the multifidi and rotators. Most often you can't reach the spinal process. Most often you have to treat like this. Here we have C2, C7. I go between C2 and C7, not on the spinal process, a little bit laterally. I'm here exactly. I show it here. And between C2 and C7, I go here in this area, close to the SP, yeah. Spinose process.
Yeah.
You are better with these abbreviations. I learned from you. This is great. SP. Okay.
Yeah, you can say like SP or TP. It's okay
It's
for
good.
us.
For me, it's also easier. I didn't
Yeah.
know. Super. So, a little bit lateral from SP, you go here deep through all layers of the muscles. It's okay? Does it hurt?
No.
No? Here?
More.
hurts?
More.
It hurts?
Hurts.
Yes or no?
Yes.
Yes, okay. And now I don't know why it hurts. I make a very big provocation for many, many structures. I have to know. I have the pressure, but I have also a little movement. And it could be that it is a joint problem because of the movement. So I have to differentiate it. To differentiate, is it a problem for reason of pressure or for the reason of the movement?
이게 이제 지금 누르고 있는 상태에서는 모든 층을 이렇게 눌렀고 그렇기 때문에 내가 어떤 구조물 때문에 이렇게 아파하는지를 알 수가 없습니다. 그래서 이게 뭐 내 프레셔에 대한 건지 움직임에 대한 건지 알 수가 없기 때문에 그 공부를 하기 위해서는 우리가 또 움직여 보는 것도 필요하다는 거죠.
Okay, if we reach to reproduce the pain familiar for the patient, you know this pain?
No.
No, but it's pain, huh?
Yeah.
Okay. Then you go and you take your hand and you make a mobilization in the same direction, in the same movement, and you ask, does it hurt again?
No.
No. Now I know it's not the movement the cause of the pain, huh? But you have to differentiate first. And if this movement would be painful, then I think it's a joint problem. Then I have to follow this path. But if the movement does not hurt, it's not a joint problem. Then I rest on the myofascial hypothesis. Okay. And then I press again. You feel the pain again?
Yes.
Yes. Okay. Then I don't know about the layer. I press the first, second, third, and fourth layer. I don't know where is the problem. So now I can take all the muscles of the first, second, and third layer, and I make a provocation like this. And now I make provocation for all muscles without the fourth layer. So I ask, is the same pain as before?
Yes.
It's the same pain now. Now I know it's not a problem in the fourth layer. It must be a problem in the first, second, or third layer. And so I can differentiate without direct palpation, but I can get the information.
일단은 첫 번째로 한 거는 관절 모빌라이제이션을 통해 가지고 이게 관절 때문인지 내 프레셔 때문인지 감별을 하는 과정을 거쳤고요. 거기서는 이제 동현 선생님은 안 아프다고 했습니다. 이런 경우에는 우리가 이제 근육 쪽, 근막 쪽으로 이제 접근을 계속 유지하면 되는 거고, 이렇게 했을 때도 아프다고 하면은 이제 관절 쪽으로 접근하면 되고, 그 다음으로 구분해야 될 거는 내가 지금 전체 층을 다 누르고 있기 때문에 이게 몇 번째 층인지는 정확하게 알 수가 없을 때는 우리 3번 했을 때처럼 전체 근육에 다 자극을 하고 다시 문진을 해서 같은 반응이 나오면은 이거는 내가 뭐 4번이나 3번 이런 쪽이 아니구나, 전체일 수도, 그 위층일 수도 있구나 생각하면 되고, 아니면은 내가 깊이 눌러야만 이 사람이 자극을 받는구나라고 생각하면 됩니다.
So please perform three things. First, we reach the semispinalis, like this or like this, one side or both sides together. First. Second, you reach fourth layer muscles from lateral. You are profound, deeper than the third level and dorsal of the TP.
Yeah, that's right.
Extra. Okay. And third, you go a little bit lateral of the SP, and you go here profound, and then you make the differentiation. Is it the movement which hurts, or is it the pressure which hurts? Yeah.
연습은 세 가지 단계로 하시면 됩니다. 첫 번째 연습 단계는 이런 식으로 한쪽 혹은 양쪽 다 해서 반가시그를 먼저 이렇게 팔페이션을 하고요. 두 번째는 여기서 이제 가로 돌기 뒤쪽으로 시작을 해가지고 네 번째쯤 로테이터를 찾는 거. 그 다음에 세 번째는 전체 SP 쪽을 누르고 그 다음에 통증이 많이 유발되거나 하면은 각 레벨마다 조인트 모빌라이제이션을 통해서 구분을 하는 거. 그렇게 세 가지 스텝 해가지고 연습하겠습니다. We go start right now.
Perfect. Yes, to get two informations, layer and fiber direction.
네, 두 가지 정보 계속 기억하면서 하겠습니다. 어느 층에 있는가랑 어떤 결을 가지고 있는가.
I know we stay now in the fourth level deep.
여기서 이제 네 번째 층까지 가면은
So I have to get the information from the reference points to know where the muscle lies.
기준점을 이용해서 어느 곳에 근육인지 알 수 있습니다.
For obliquus capitis, inferior, we have here SP2 to TP1. And then I see it's a muscle in the U system, very flat. Okay.
V 시스템을 갖고 있지만은 굉장히 좀 평평하게.
And I visualize this connection between my two fingers.
이 시각적으로 한번 상상을 해보는 거죠. 손가락 사이에 이렇게 있다고.
And then I know there is first level, second level, third level. But if I take now all the three muscles of the first, second and third level, and I go laterally of the semispinalis, I see I'm very close to the fourth level. And you can reach it very easy here. So please don't start here. Don't start laterally from the semispinalis muscle. Then you will reach it best. Then you have just the semispinalis capitis which overlies this muscle. This is a thin muscle, and so here you reach very often to palpate the obliquus capitis inferior. Okay. So I go deep with my finger. I stay deep with the pressure, and then I move perpendicular to the fibers of the obliquus capitis inferior. Then I release a little bit. I go in the fiber direction of the obliquus capitis inferior. I go deep, and I go again rectangular. And then I can very often feel there are fibers in this direction, and this must be the obliquus capitis inferior. Okay. And then I go in the direction medially, and you see I can move away a little bit this longus, this semispinalis, and I perform the same task. And so I make several provocations, and I ask, is it equal on every provocation side?
다 누를 때마다 같은 동작인가요?
Is it equal every side? More or less.
Under pressures.
Here was more.
Yeah.
Okay. And so I'm looking again for the side which is most painful. Second criterion. And then I continue, and here I have to go through all layers of the muscles, okay, to provoke. This is obliquus capitis inferior. Then I continue, obliquus capitis inferior, and from here, from PT directly behind the process mastoid, there is this obliquus capitis superior. Those are the reference points. PT1, dorsal of processus mastoideus. And then I know this direction. I'm dorsal from the SCM, and I go here profound, deep. I rest deep, and I go perpendicular to this muscle. And sometimes you can feel it there. Dorsal from the SCM. It's okay? If you can't feel the muscle, it will not have trigger points because he has no taut bands when you can't feel it, so it's no problem. But if he has trigger points, he has taut bands and you can reach the muscle easily. Then, for the rectus capitis posterior major, I take here SP2, and I go here again dorsal of the processus mastoid, here and the occiput. And I know this is the direction of the rectus capitis posterior major. I don't feel the muscle, but I know here profound it has to be, and a little bit higher and medial must be the rectus capitis posterior major. So my vision is I see here a triangle. Triangle here, here, here. And this line of the triangle, which is rectus, the capitis posterior major, and then in the middle of the triangle will be the rectus capitis posterior minor. Okay. And if I have these reference points, then I go on this muscle and I make the provocation on 2, 3, 4 sides. It's okay?
Yeah.
Slowly, 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 slowly. I go deeper and deeper and deeper. Then I release. I go on the second point. It's okay?
Yeah.
I go on the third point. It's okay.
Later.
Huh?
Yeah.
It hurts here more.
Later.
Okay. So I'm looking for this. Is it equal each point or is it different? Okay. And I saw here little pain, and here more pain. So I'm looking now here for the active trigger points. It's okay? It hurts.
Okay.
Do you know the pain?
Yeah.
Yes. Oh, this is great for our experience. And like this, it hurts or it doesn't hurt? Not anymore. Okay. So I know I can provocate this pain, making this pressure. And again, performing this pressure, I have pressure, but I have also a movement you can recognize, a movement in the cervical space. So I don't know, is it probably an instability? And then it would be forbidden to mobilize here in this region. So first I have to know, is it the pain because of the movement or because of the pressure? So I go in this area and with a flat grip I move, and you see I move more than before. Does it hurt now? No. Now I know it's not the movement the problem. If this would be painful, I wouldn't touch anymore because I don't know what is the reason that this movement creates the pain. It could be an instability or a fracture of here from atlas, ligamentum alare problem, and I wouldn't touch anymore. I would call the medical doctor and give him the information. I'm not sure. There I have sign. I can't make the interpretation. It could be a severe problem. Please make the decision making. I can't perform this as physiotherapist. I know there are colleagues, they say, yeah, we have this test and this test and this test, and I think this is nonsense. Why? I practice this now for longer than 10 years. I never had a positive test when I performed like this. So I know this is very seldom. And I can't make a reliability of a test if I can't perform them daily. So all these tests concerning the instability in the higher cervical region, in my opinion, I can't prove them, I can't test them, I don't know. And the risk is too high if I make here a mistake. It can be very, very bad. So for me it's clear, I make this test, if it doesn't hurt, it's no problem to press, because the movement, there is no pain, I'm allowed to make this. And if the movement creates the pain, for me it's too dangerous. I would say, please go to the medical doctor with the MRI and all the things. We can make wonderful diagnosis, and I make no risk in this area. Okay. Who needs a translation? Who wants translation?
저 통역 방금 부분에 대해서 앞은 다 해부학이었고. 저 이제 앞에는 해부학적인 그런 위치적으로도 다 이렇게 설명을 했었습니다. 그래서 그 다음에 마지막에 했던 내용들은 우리가 앞전 그 머슬들 할 때도 이게 움직임에 의해서 통증이 발현된 건지 내 프레셔에 대해서 발현된 건지 모르니까 이제 모빌라이제이션을 통해서 테스트를 합니다. 근데 아까 상황과 반대로 이번에는 만약에 모빌라이제이션인데 지금도 아파요, 똑같이 아파요 하면은 당장 그만둬야 됩니다. 이게 이 부분에 대해서는 이제 로 선생님도 되게 많은 경험을 해봤지만은 한 번도 이 같은 통증이 모빌라이제이션 나타났을 때 진행한 적은 없었다고 합니다. 왜냐면은 여기서 뭐 인스테빌리티나 뭐 조인트 리가멘트 이런 문제가 있을 수가 있어서 바로 닥터와 상담을 해야 됩니다. 왜냐면은 이 부분에 대해서 근육이 아닌 문제라면은 엄청나게 위험 요소가 많은 부위이기 때문이라고 합니다.
제가 생각할 땐 그런 거죠. 왜냐면 C2SP를 밑으로 모빌라이제이션 시키는 거는 우리가 트랜스버스 리가멘트 테스트 할 때 우리 레드 플래그죠. 레드 플래그 했을 때 이거 했을 때 인스테빌리티가 있다는 거는 진짜 리가멘트에 문제가 있을 수 있기 때문에 닥터한테 보내는 게 낫다. 그때 통증이 있을 때는 자기가 하는 것보다는. 근데 이거 했을 때 만약에 통증이 없다면 그대로 적용해도 된다 이 말인 것 같습니다.
Okay. So once again, for rectus capitis posterior and minor, I palpate the SP, and then I go dorsal from the
TP.
No. For the rectus, not I go to the processus mastoid, to the occiput. Yeah, this is important.
유양돌기랑 TP랑 구분해야 된다는.
For the rectus capitis minor, I have SP to occiput. From SP to PT is obliquus capitis inferior. This is very important. So I go to the occiput. I have this triangle. I provoke in several sides. We had here the. I can reproduce again.
Yeah.
Okay. Then I make this. This didn't hurt. And then with pressure, I don't know which layer, in which layer is the problem. So I provoke again. It's okay? You feel it?
Yeah.
Okay. And then I take everything I can with this pincer grip and I provoke too. Same pain?
No.
No. Now, where is this problem? In the fourth layer. Okay. It hurts also because it's a strong pressure, but it's not the pain he's familiar with. Okay. So I know I have to provoke in this direction. It arrives again? Okay. So I know it's rectus capitis posterior, major or minor, and I can go because I know now I am over the minor, it's the minor. Okay, then to finish, we will be ready.
그래, 제일 첫 번째 근육 할 때 옆불뛰기에서 접근하지 말라는 겁니까? 그 처음에 설명해 줬잖아요. 세미 스파이널리스 설명하면서 같이 맞아요?
그럼 할 수 있다는 거 아니에요?
할 수 있다는 거야? 할 수 없다는 거야?
아, 가쪽에서 하지 말래?
가쪽에서 하지 말라 했던 거 아니에요? 그 다시 한번 물어봐 주죠.
지문의 표지가
제일 첫 번째 근육할 때 우리가 그 C1의 트랜스버스 프로세스를 찾고 그죠? C2의 SP를 찾았잖아요. 요렇게 껐는데 얘를 찾을 때 가쪽에서 하지 말라는 말인지 가쪽에서 할 수 있다는 말인지
when we're trying to calculate oblique capitis inferior,
Yes.
is it okay for started from lateral side?
Yes, I proposed for the obliquus capitis inferior. You start lateral from
Yeah.
this.
아,
For the rectus, he goes in this direction. You can try, but I don't trust that you arrive. And the rectus capitis minor, you can't reach from lateral. So I propose just for the obliquus capitis inferior to start here, where you can be really lateral. And for the rectus capitis major and minor, I go through all muscles and then I differentiate in this.
Thank you.
Okay. What's in this part? No problem. Okay. Please take the arm here. Keep the arm in this.
팔을 딱 유지해.
Yes, great. Now we see very beautiful here the clavicle, pectoralis major, deltoideus, the anterior board, and here is this fossa.
자, 여기 기가 막힌 빗장뼈가 있고요. 여기서 우리가 펙토럴리스 위쪽 섬유를 볼 수 있고 델토이드 앞쪽에 있고 여기에 움푹 패인 곳이 있습니다.
Yes. And the main axis is here directly on the under part of the clavicle.
클래비클의 아래쪽으로 이렇게 누릅니다.
The muscle runs like this, parallel to the clavicle.
네, 그 빗장 쇄골의 가장자리부터 요렇게 근육이 지나가고요.
To reach it better, please perform this movement. You go to the ceiling with the arm.
저쪽으로 밀어보세요.
Yes, you make anteversion here. And through the anteversion, you can reach here under the clavicle. He has to perform it actively because the anteversion is not an action of the subclavius, it's an action of other muscles.
다른 근육이 안테버전을 만드는 것에 있어서 그 세라투스 같은 근육이 만들어내기 때문에 이렇게 환자가 직접 액티브하게 밀고 있어도 클비우스의 압력이 덜 들어간 채로 텐션이 덜 들어간 채로 누를 수가 있습니다.
And I press the muscle to the clavicle.
그래서 클래비클 밑에 있는 이제 근육으로 더 깊게
And then
생기니까.
I follow the clavicle and I provoke the muscle. It's the provoking diagnosis again.
그래서 지금은 빗장뼈를 따라서 지금 자극을 직접적으로 하고 있는 겁니다.
It hurts.
아픈가요?
It's too much.
원합니다.
You don't know it? This is one axis. Second axis is you go, excuse me, you go in this part, on the upper part, on the dorsal part. And then you are looking here. And if you find trigger points, you say, go to the ear with the shoulder,
뒤쪽으로 뒤쪽으로
with the shoulder to the ear, with your shoulder to the ear.
어깨를 귀에 붙인다 생각하고
Yes.
움직여.
And now away from the ear. And so you push the clavicle over the finger and you reach very well this part of subclavius. Be careful that you keep the anteversion. And then you can make both axes together. You go here and here, like a piercing around the clavicle, and then you go here.
첫 번째와 두 번째 방법을 동시에 사용하고 있고요. 두 번째를 할 때는 이제 손가락 위에 클래비클을 얹어간다는
Okay.
느낌으로 액티브하게.
I repeat, most important to keep the anteversion. If he goes back, I can't reach here. You have to keep this position. You make it very well, but the patient often can't keep it in this anteversion position.
요거 자주 설명해야 됩니다. 왜냐하면 이 테크닉을 할 때 안테버전을 유지해야 되는데 환자가 종종 까먹고 점점 내려가기 때문에.
Okay. Okay. Yeah, it feels good. It looks crazy, but it feels.
볼 때는 아파 보여도 상당히 시원한 테크닉이라고.
You feel comfortable?
네.
That's good. Okay. Technique 3.
3번입니다.
Okay, so please practice this each for 4 minutes and then we will continue.
자, 4분 정도 연습을 하고 바꾸고 또 진도 나가도록 하겠습니다.
Follow the ribs under the pectoralis major. I can feel here it makes plop, plop, and this is the minor. Okay, the lateral fiber of the minor. You can treat. You can try to go with the shoulder in depression, exactly. Then you have an activation of the pectoralis minor, and you can feel this activity, and you release. Perfect. And again, then I feel the activity of the pectoralis minor. Okay. And if you want, you can release. Then you can go between the pectoralis minor and the pectoralis major. You say if it's enough. Huh? I go here, I feel the fibers, and I can go very deeply if the patient agrees. You release, please. Yes, perfect. And so this is a facial separation technique, technique 4 between major and minor. Okay. And if it hurts now, it's clear it's a problem in the minor. Then you can try to perform also a facial separation technique between the pectoralis minor and the ribs and the intercostal muscles. This is in this lateral part. I go now lateral from the pectoralis minor, and I try to go between the pectoralis minor and the ribs. Okay, it's a layer deeper. I can show it here. We have the pectoralis minor in this position. So first access was to go in this. Here is pectoralis major, and this is pectoralis minor. Huh? So first I make the separation technique here, and then I go here and I try to make a separation technique between the pectoralis minor and the ribs and the intercostal muscles. Huh? Okay. Here you can't reach very far, it's just limited, but sometimes this helps a lot to go in this area too. So you have two separation techniques between major and minor, and between the dorsal part of the minor, between thorax, ribs and the minor. Okay. And then we perform again. I can make a little retroversion and the technique 3.
이것도 지금 왼손으로 레트로버전을 만든 상태로 유지하고 하고 있습니다.
It's okay.
괜찮나요?
Okay. This is one position you can treat very well. And a second position, please, on your right side. Please put the hand like this. You keep it. Yeah, you can take your arm where you want. You go in this. Yeah. But you can use this arm as a pillow.
베개처럼 손을 깔고 이렇게 베개처럼.
Yeah, this is best position. So, you know, you stay like this. It's just for demonstration reasons, so you can see best what I perform. Otherwise, you can put the arm where you want, but so you can see it best. So in this position, it's very comfortable to reach the muscle behind the pectoralis major. And it's very comfortable. You treat here the serratus, the stabilizers of the scapula, and then you can, without changing the patient, you can go to the pectoralis minor, which is in the same group of muscles to stabilize the scapula. And with ladies with big breasts, the weight of the breast falls away from my fingers, so it's very comfortable to treat. And then you can reach under the pectoralis major. I feel here the fibers of the minor. And here too, you can say, please go to the ear with the shoulder, elevation,
Okay.
and then depression. And in the depression, you can feel the activity of the pectoralis minor.
네, 어깨 안정화 근으로서 세라투스 안테리오랑 펙토라리스 마이너가 같은 그룹에 속했기 때문에 이 자세를 하면은 세라투스 치료하고 바로 들어갈 수 있어서 좋고, 또 여성 환자 같은 경우에는 이제 유방의 무게 때문에 이 자세로 하면은 이제 비켜주니까 좀 더 그때도 효과적으로 쓸 수 있는 자세라고 하셨습니다.
Yes. So please practice this each for 5 or 6 minutes. From C6, C7. This is here. And it runs also to this point. This is very comfortable, so I know the direction of the rhomboids. It's very clear. This is rhomboideus minor. And the major rhomboid, he goes then to the inferior angle, and it's parallel that you see. It's a very, very big muscle too. So this is fiber direction of rhomboids. So my palpation direction now changes. I have to go perpendicular to the fibers of the rhomboids. Most easiest way is to start here in this region, because here often you can find the muscle fibers directly here.
저 공간이 다른 섬유 그 부분에 비해서 좀 열려 있는 공간이라서 저기서부터 팔페이션 하는 게 좀 쉬운 방법이라고 합니다.
Okay. And if you feel here fibers which is plopping, it's not possible that this is the trapezius. Why?
여기서는 이제 블록블록 걸리는 게 촉지가 가능합니다만은 여기서는 이제 촉지하기가 어려운데 이유에 대해서
Exactly, because of the fiber direction. I run now parallel to the trapezius, and so it can make plop plop. So if it makes plop plop, it has to be the second layer of the muscles. It has to be rhomboids. Exactly.
네, 두 가지 이유에 대해서 말씀을 해주셨습니다. 두 번째 층에 있는 그 덮여 있는 이 때문에 하나의 이유고, 이제 다른 이유는 여기서 블록블록 거리는 거를 느낄 수가 있고, 이 어퍼 트라페지우스 같은 경우에는 여기를 지나가기 때문에 여기를 이렇게 만졌을 때 어퍼 트랩의 결을 느낄 수도 있지만은 어퍼 트랩의 결이라고 그게 배제될 수가 있는 이유가 방금 요렇게 팔페이션을 했죠. 근육결의 롬보이드의 근육결의 수직으로, 그래서 롬보이드는 만질 수가 있는데 결이 볼록볼록하게 느껴지는데, 로어 트랩 같은 경우는 결이 이렇게 되니까 우리가 이렇게 결 따라서 만지고 있으면은 로어 트랩에서의 블록블록거림은 조금 배제시킬 수가 있다는 겁니다.
Okay. And then if you feel the taut bands, you follow the taut bands, you are looking for the spot tenderness, and then you can treat it. This is simple. Now to the third one. We have the serratus posterior superior. He runs here at the same direction, but up to T2. C7, 1, 2. So it's just in this part to the ribs, not to the middle border. He goes to the ribs, but it follows. He lies in this area.
오리진 같은 경우에 위쪽 섬유에 대해서는 같이 척추 삼각으로 가는 게 맞고, 아래쪽 섬유의 경계선은 이렇게 갑니다. 근데 이제 아까 설명했죠. 스캐뿔라 어깨까지 가는 게 아니고 립에서 끝나는 머슬이라는 거.
And so we have to be aware that the shoulder is maximal in lateral position.
최대한 가쪽으로 스캐뿔라 당겨놓고 시행합니다.
So I palpate here the angulus costae. Please translation, I go. You see the rib forms here a characteristic an angle, angulus costae, and the muscle runs from C6, C7, T1, 2 to here to the outer side of this rib angle, because between the rib angle and here will run the erector trunci, and the serratus posterior superior lays over the erector trunci and spans the erector trunci to the spine. So we have to palpate this rib angle and to feel its scapula enough laterally that you can feel this rib angle, and then you are correct. And if you can't feel the rib angle, you have to go further with the scapula by side. So I palpate the rib angle here, I can feel it very well, and then I follow this rib angle and I feel, okay, here is the rib angle and the border of the scapula is here, so it's perfect. If this wouldn't be, I have to change. I have to put the chair here and to say, okay, please come a little bit laterally.
가쪽으로 쭉.
Perfect. And then you can put the shoulder here, and you see the shoulder goes more laterally, and then you can feel easier the rib angle, and you have enough space to treat and to find this insertion site. Because most trigger points in serratus posterior superior are in this area where often the muscle is covered by the scapula.
네, 저기도 나와 있고 이게 갈비 모서리가 갈비 모서리가 요 지점 부분에 있습니다. 근데 요 지점을 따라가다 보면은 팔이 만약에 이렇게 되어 있을 때는 스캐풀라에 가려져 있지만은 이렇게 펼침으로써 공간이 나오게 되고, 그리고 이 과정 이렇게 포스를 취하는 게 굉장히 필수적인 게 대부분의 세라투스 포스terior superior에서 트리거 포인트는 요 인서션 위치에 있기 때문에 이렇게 드러내는 게 치료의 필수라고 합니다.
And you see the problem we have now, both muscles, the rhomboids and the serratus posterior runs the same way, and I don't have any possibility to differentiate.
결이 완전히 같고 방향도 위치도 같기 때문에 팔페이션을 구분하는 게 거의 불가능합니다.
Okay, I have to accept this situation and to do my best, and I will start with provoking.
네, 구분하는 데 있어서 할 수 있는 최선의 방법은
I know where the muscle must run, and then I perform this provocation. It's okay? 1, 2, 3. It's equal? 3 is more here. Okay. And if you can reproduce the pain the patient is familiar with, then you can treat it. And for treating, you say stop please if it's too much. It's okay? It remains local?
터지나요 아니면
그대로
로컬?
Local. Okay. If there is a local pain, and this pain is the pain the patient is familiar with, we have an active trigger point, and then we don't know from which muscle does it rise. It could be middle trapezius, it could be a rhomboid, it could be serratus posterior superior. But when I press here and the pain goes to the elbow and the arm, then I think it's the serratus posterior superior. Okay. For treatment, please take a wooden tool.
나무 툴을 쓸 거고 여기서 우리가 지금 여기서 통계가 유발됐지만은 이게 우리가 방금 언급한 세 개의 근육층에서 어떤 건지 알 수가 없습니다만은 이 만약에 로컬하지 않고 리퍼드 페인이 나타나는데 팔꿈치 쪽으로 간다 그러면은 우리가 세라투스 포스테리어 수페리어라고 생각을 해볼 수가 있습니다.
I make the diagnosis with my fingers, but for treating, it's more comfortable to do like this. It's okay? It's okay. Which technique?
어떤 기법이죠?
2A.
Yes, exactly. It's the same. You see, slowly, with firm pressure. And my fingers are very released. Okay. Or I make it like this. Technique.
3번 이렇게 적용.
Both for rhomboids and for serratus posterior.
롬보이드에 대해서 적용될 수도 있고 세라투스 머슬에 대해서도 같이 할 수도 있고.
Okay. This first success I'd like to show you in lateral position. May I use you, please?
모델로.
Model, as model, yeah. Because I think I can show how to take away the muscle. Thank you so much. I know the muscle runs like this. I show how I can move a little bit, and then you see here I can take the muscle, it makes plop, and now I know it's just the trapezius, the lower trapezius. And for diagnosis, it's perfect if it's possible to make it like this. Here it's very easy. I've just plop this lower trapezius, and please try first if it works. If it doesn't work, call me. Probably I can show you how I can manage it, and if it's not possible, it's no problem. Then we go in the stretching position and we treat it like this, and then we go in front position and we follow as I showed with you. Okay, thank you so much. Please practice this.
실습 시작.
S, T, and PT. Okay, so this is about 2 fingers space, and in this area I perform a technique 3 with a wooden tool. Please not on the SP. Please not. But little far beside, I start here.
다 아시겠죠? 그 멀티피드스는 촉지하기 힘들기 때문에 이 TP하고 SP 사이에 손가락 2개 정도 사이에 들어있거든요. 그래서 이거는 이제 프로보케이션 테스트로만 이루어질 수 있습니다. 그래서 훑어가면서 이제 확인할 거라고 얘기하십니다.
And I ask, do you feel similar the pain in each part, or are there differences?
그래서 자기가 원래 앓고 있던 통증인지 한번 물어보는 거예요.
Similar pain is
Similar pain.
continue.
Similar,
Yeah, similar.
similar,
Similar.
similar,
Similar.
same,
Same.
same, same, same.
Oh, a little bit.
A little bit more. Same,
More pain.
more pain, and here
It's reduced.
it reduces. And you see,
그래서
very fast.
방금은 굉장히 빠르지만은 이제 알고 있는 통증도 맞지만은 같은 위치마다 같은 통증인지 아니면 위치가 다른지를 물어보는 과정이었습니다.
And you see, very fast I find the site where the problem lies, or if there is no problem. So I start again. It's okay?
Yes.
When does it hurt more?
In here.
Here? Still? Or
No.
when?
It's
Huh?
the most spot.
Here is most.
Yeah, most painful spot.
And you see, I'm looking for the spot with the most pain, and I found it. This is second criterion, spot tenderness. And if I found this hot spot, I remain here and I give more pressure. It's okay? Does it hurt?
It's okay.
Do you know this pain?
Yes.
Yes. What have you found?
자, 이렇게 제가
이거
뭘 찾은 거죠? 이제 active.
Yes, an active trigger point. It's as easy, and it's the fastest way. And now I'm here, and for the treatment, it's okay?
Yes.
You know the pain?
Yes.
Please lift your left leg.
hold.
Yeah, and the other one. And the other one. And the other one. Okay. Which technique I perform?
To be.
We have to think carefully. For sure, he moves the leg, but the rotators and multivity here, which task they perform? They perform stabilizing. So it's 1B. It's a little bit tricky, but we can clearly distinguish. The movement is in the leg, but here it's more or less no movement. So it's 1B for the technique. You continue. And this is very, very efficient. The pain rests, goes up or down?
Goes up more and more.
More and more.
Yeah.
So you continue or say stop if it's too much. It gets more and more.
No, it's reduced.
And you see, this is sometimes the case. First more and then less. And if the patient bears it, you rest. Why? I have the hypothesis in the first case, the superficial layers, they release. So I have more pressure on the critical point, so the pain goes up. And with the treatment, it releases in the multifinular rotators, and then the pain goes away. Okay. This wooden tool is specifically created for this treatment. You see, if I have the small one, I'm a little bit too close to the patient in my feeling. If I take this, I'm too close, too near to the patient. I have to feel comfortable, the patient has to feel comfortable, and for this reason it's a little bit longer. And if I put my hand here, I can go with my chest, and my fingers have holidays. It's no pressure in my fingers, and I can put the weight firmly here to create this this treatment. So this is very efficient. Please try. So this is the treatment. Important. Please go with this provocation, as I showed also here of the sacrum, because here often lays trigger point. In your case, not. You had a hot spot in this region, and here less pain. Then it's important to look about the patient. This is perfect. It runs well. It's perfect.
Pinch and roll.
I don't know here.
Pinch and roll.
Pinch and roll.
Pinch and roll.
Pinch and roll.
Yeah.
Often it's called Kibler-Falte. Then you can try to make it like this. This is perfect.
정리쌤 나온 이유가 다 있구나. 잘하고 싶어서.
And you can try to lift it. Because I used a little bit non-stress, I go over the spine and I take the whole tissue.
살이 없네.
Then I go in pre-stretch and I make like this. I use this paper because I used a little bit of massage oil and then it's slippery. So sometimes it makes. I go here and take it. Inspiration. Inspiration. Joe, inspiration.
숨 들어 마시고.
Expiration.
소리 나다.
We don't know why. It doesn't matter. It doesn't make great sense, but it's
왜 소리 나는지
once
모르겠지만
again
소리
inspiration
나.
다 빠진 소리.
and expiration.
소리가 나나 이게.
Yes. Okay. those are techniques in this area. Now please sit on a chair. On a chair, yeah.
이 진정 환자지.
No. It's difficult.
아까 얘기했죠. 여기에 원래 좀 많은데 이분 여기에 좀 TP가 많다고.
Please sit. Please sit here. How do you feel? It's okay?
Yeah, that's great.
And then for technique 3, please go in this position. Bend forward. Now we have the pre-stretch, and I can perform this very well with my elbow or with a wooden stick, but it's very comfortable with the elbow to practice this. It's okay?
Can you use it?
I had a little bit of body milk. Yeah, because I had before the body milk, and now the skin is perfect for the treatment. But if you feel it was like this, then you take more body milk for sure. Okay, that's it. Please. So first, identification of these reference points. I am looking here for the crest, iliac crest. I am looking for the 12th rib. And then I start with palpating in front of the muscle. I'm at the crest, and then I go back and I feel here. I can't enter anymore as far in front. Here I can show it again. The paper, the model is there. Here. You see the muscle runs like this. And first I am looking here and here, then I have the orientation. As next, I start to palpate, not here, I start to palpate here. Why? Here I can enter forward, and if I reach this point, I can't anymore reach, go forward, and then you know exactly where is the border of the quadratus lumborum. So I start here laterally, I go medially, and I feel, oh, I can't go anymore anteriorly, and then I know here I have the border of the quadratus lumborum, and then I follow the border of the quadratus lumborum.
네, 저기서 일단은 베개 까는 이유는 저희 공간을 좀 더 열어서 통제하기 쉽게 하기 위함이고요. 이 상태에서 바로 근육으로 들어가는 게 아니고요. 일리악 크레스트의 앞쪽에서부터 시작을 하는 이유가 여기는 근육이 없지만은 여기 앞쪽에서부터 시작하다 보면은 갑자기 내 손가락이 더 이상 안 들어가는 그런 상대적인 어떤 팔페이션이 좀 더 깊이 들어가기 힘든 부위가 있습니다. 여기가 이제 쿼드라투스 lumborum 시작하는 부위라고 생각을 합니다.
But the direction is not like this, it's really like this. This is important, otherwise it doesn't.
그리고 중요한 점은 이렇게 방금 손가락처럼
Yes.
요렇게 누르는 게 중요하다고 합니다. 손가락 방향, 요 형태로 이렇게 들어가는 게 아니고 요렇게.
Yes, for the identification I make it like this. I show it here. I have here the crest, and you see I go in this direction forward, and now here I can reach very far. And I go back and I feel, oh, I can't reach anymore because it's a limitation, and this limitation is the quadratus lumborum itself. So I have identified the border of this quadratus lumborum. Then I follow the border of the quadratus lumborum. It's okay? Okay. And then I go on the quadratus lumborum. Okay. And then I look for sites which are painful. It's okay? Does it hurt?
Little pain.
A little pain. You know this pain or not?
Oh no.
No? How is it here?
Oh,
You know the pain or not?
비슷한 것 같은데.
Huh? Can you translate?
It's similar.
Similar, okay. And how is it here? Similar or not?
Okay.
not here. Yes? Okay. And you see, it's very little space, 1-2 millimeters. Here the pain is known, here it is not known. And this is a very good sign, because this means it's not a generalized problem, it's a very specific local problem, as we described with trigger points, a local area, not all the muscles, not whole the area. It's just a little point in this whole area. Translation?
네, 그래서 아까 봤듯이 되게 선생님이 조금 이렇게 움직였는데 그때마다 통증 양상이 변한다는 거는 우리 실습자 굉장히 좋은 신호인데 우리가 방금 배웠듯이 굉장히 국소적인 통증이 나타날 수 있는 근육이라고 배웠습니다. 그래서 이게 해당되는 신호라고 생각할 수도 있는 가능성이 있는 겁니다.
And you see the quadratus lumborum runs laterally from the PT. He doesn't go to here, he just goes to the transverse process. So it's no conflict with the erector trunci. The erector trunci lies medially, and I can push it a little bit by side, but the quadratus lumborum, he stops here. Okay. So,
네, 그리고 또 하나 신경 쓸 점은 이 SP와 TP 사이에서는 에렉토가 지나가는 공간이고 그래서 우리는 TP부터 이렇게 구역을 명확하게 해서 눌러야 된다고 해서 적었죠.
exactly. So here I have the lateral border of the quadratus lumborum. Then I'm on the quadratus lumborum, and you see here is the erector spinae. But this is no problem because the erector spinae runs between the SP and ST and the PT, and so it's not a conflict. The longissimus and iliocostalis don't cover the quadratus lumborum, because in Europe many people think there would be a conflict, but there is no conflict at all. I can reach it at the quadratus lumborum, and I can make confrontation, provocation. I'm looking for the most painful spot. And you see in this dorsal part of the muscle, it's less reaction. Then I go back to this region here, and you see the sign. This is international. This I understand very well. Do you know this pain?
Yes.
Okay. And then is the moment to treat.
그래서 저기서 했던 내용을 한 번 더 강조를 했고요. 그래서 퓨엘 같은 경우에는 이제 에렉토 같은 머슬들에 의해서 커버가 되지 않는 위치에 있기 때문에 두 개를 구분하는 것은 크게 어렵지는 않고요. 그리고 선생님이 한 번 더 살펴이 프로모팅 테스트를 하기 위해서 이 경계면에 있는 등 쪽에 있는 부분을 눌렀지만은 그렇게 뭐 아파 보이거나 사인을 주거나 하지는 않아서 지금 다시 아까 통증이 발현됐던 부위로 갔습니다. 그리고 이제 찾았으니까 치료할 시간이라고 말을 하셨고요.
And which technique I performed during the translation?
지금 어떤 테크닉?
Which technique I performed?
지금 테크닉 뭐죠?
Technique 1. Whole time I used for treatment, so I practiced technique 1. Now I change to technique 2A. It's okay? It's too much?
Oh, okay.
It's okay, great. I can perform it like this. Or, most often, I practice like this. Please make this leg straight. The knee rests like this, and then you go in this direction with the whole foot, yes, and you come back, and you go long and back. Perfect. You continue. Does it hurt? I don't hope, because it's just the introduction. Then you stop. I go on the point. It's enough. You feel your pain?
Pain.
Okay. And now you make this movement. You go along and back.
근데
And up.
이렇게 하면
Yeah, now it's very, very heavy.
왼쪽이 더 아픈데.
왼쪽?
왼쪽이 아픈
왼쪽
She
어디가?
got a pain when you move.
Yeah, yeah,
Oh.
when she moves. This I know.
She got a left.
But you
left
see-
side, left
She
side,
feels
left
a
side.
pain in
Ah,
the
and
left
the left
side
side.
when she moves.
Okay, once again, please move. You feel it on the left side?
이렇게 내릴 때
When you make her leg and go down.
그래서
Okay.
아파.
So she has on both sides a problem, the quadratus, because the left quadratus lumborum makes the movement when she pushes with the right side. So this, please push as far that you don't feel the pain.
통증이 안 느껴지는 선 안에서 제일 멀리 보내보십시오.
Can you make the movement little that you don't feel on the left side? Yes, great. It's okay? And now you rest in this position, and the muscle is pre-stretched, and I go on the muscle, pre-stretched.
그래서 지금 다리를 뉴트럴보다 조금 내린 상태라서 프리스트레칭이 된 상태에서 프레스를 누르고 있습니다.
And now you make a little movement, yes, that you don't feel on the left side, just on the right side.
지금 왼쪽에 느껴지는
Perfect, yes.
a little bit in left side.
So you go make smaller the movement.
조금 더 작은 움직임으로 작은
Yes,
움직임으로.
perfect. Left side okay?
이렇게
Great. Now you rest in the position that it doesn't hurt left, but you are alone. You rest here, and I perform a technique 3 in pre-stretched quadratus lumborum. Very efficient.
그래서 통증이 느껴지지 않는 선 안에서 프리스트레칭을 유지한 상태에서 테크닉 3를 적용을 하고 있습니다.
Is it okay?
괜찮아요.
You see very slow in pre-stretched position.
굉장히 천천히
From one side to the other.
한쪽으로 갔다가 반대쪽으로
From this side to the other. It's okay? Great. And now, something free. You release. Yes. Now, calm down. It's okay? Okay. It's too much?
Yeah.
Okay. There is a stop, please. I go here. I go here. Iliacus. Huh?
Oh, okay.
Pain. You know the pain?
Yeah.
You know the pain.
Yeah.
Okay. And like this, no pain?
Okay.
No pain. It arises again?
Okay, pain.
Yeah. You know the pain?
Yeah.
Yes. Now I don't know if the trigger point in the abdominal muscles or in the iliacus, because I press both. So I differentiate first, is it a problem in the superficial muscle group, in the abdominal muscles, or in the iliacus? Please cross your arms, both. Perfect. I go again on this point. You say if we reach the familiar pain.
The pain.
Pain.
Yeah.
Okay. And now I stay firm, and please come to my hand with your elbow and lift your head. Upward, yes, and a little bit to this side. Yes, perfect. Now more or less pain? If you come up,
Yeah, less pain.
less pain.
Yeah.
Okay, there is a problem
문제는
in the deeper layer, because the superficial layer pushed me away. Huh? So I know it's a problem in the iliacus. So I perform. Okay, then I go. You can open again here. No, we have to treat the iliacus. Okay. For the treatment of the iliacus, I stay here. And then, please make straight your leg and bend it again. And come with your leg here, with the knee here to my hand. Exactly. And down on the table, and yes, you continue this. This is technique 2B. You see, I stay here firm, and there is a very good treatment situation. Okay, and stop. This would be treatment of iliacus. Please come again in this position. Then I'm looking for the psoas. For the psoas, it runs medially. Here is the spinal cord, and the muscle is lateral of the spinal cord. This is important to understand. The psoas is here between the processes, the lateral part and the bone. So it lies here by side. I have the paper again. So it lies in this region, not here. It lies here. This is important. So I go with 2 fingers and I go slowly, slowly down, deeper and deeper, very slow, that every internal organ can go away. It can escape, find a ways away. And when I reach the bottom, I say, please, no, please lift your knee 1 centimeter.
1cm.
Yes, perfect, and down. And with this activation, I have an activation of the psoas, and I can feel the changement of tension in the muscle. So please lift a little bit. Yes. Does it hurt?
Yes, pain.
You know the pain?
Yeah, pain.
Yes, and down. So, which technique is this?
1B.
1B. You see, lifting, there is no movement in this region. It's just the activation of the muscle, and this works very well. You can feel I'm on the right spot. Then I don't press. I change a little bit. I go down again. Please lift a little bit. Yes. It's less, huh? Yeah. Here. Once again.
Oh, pain.
More. And you see, 2 millimeters changement of place, big difference. You know this pain?
Yeah.
Okay. You lift again. And then you come here to my hand. It's possible? Great. Down. And yeah, now straight the leg. And now I perform technique 2B. Also for the psoas. This works very well. It's okay?
Yeah.
Great. And pause. And so I go step by step. Provocation, palpation. Yes. And lift a little bit. Lift a little bit. It's no problem.
No problem.
And you see, it's a huge difference. I go back. Here.
Okay.
Yeah, pain again. Here.
Oh, more pain.
More pain. Okay. To my finger and down and. There we have externus abdominis runs like this. Internal abdominis runs like this. Transversus abdominis runs like this. And the rectus sheath is here and the muscle runs like this. Okay. Then we just practice for the transversus and the obliquus externus, external and internal oblique. When we treat in this area the iliacus, the psoas, we treat them together with mentioned, with the muscles I spoke about. And if we have a problem here at the iliacus, as I showed, to differentiate, we have then to lift, to come up, that the muscle is activated, and then I can decide it's a problem in the superficial or in the deeper layer. So we work in everyday practice. What we haven't practiced is the rectus. Please lift your head. Then I can feel where is the border of this rectus sheath. Huh? And then there are many possibilities. How is it the situation? Sometimes it's very tense, sometimes there is no tension at all, and you have to look it should be possible to press a little bit in this direction here. This works well. If it's too deep, without tension in the muscle, then I have to say, please lift your head. And then there is a little tension in the muscle, and then I can provoke the muscle. It's important here to examine these different regions, and then you will find these areas with pain recognition. Okay. Then we have the intercostal muscles. They are a continuation of this external and internal oblique, and I can go here between the ribs, and easiest way is here to go between the ribs with one finger. With the other hand I can press, and then I have like the wooden tool, something to press inside and to see if is it possible to get pain recognition. Okay, this I can the space a little bit bigger if you go with this hand behind the head, and you make a lateral flexion of the body. Exactly. Now I have more space, and so I can perform the examination of this intercostal space. For this part, it's comfortable to lay on the back. For the rest, it's better to lay on the side. This is clear.
여기까지 혹시 다 캐치 하시죠?
It's okay? Great.
더 못하던데.
몇몇 분들이 제 눈을 자꾸 마주치고.
Okay, please come back. Then, for the diaphragm, I can go here at the lower border of the thorax, and I feel the ribs. And with 2 or 3 fingers, I go around the ribs, and I try to reach the inner part of the ribs. I go slowly, 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 and in this phase of the examination, it's not a treatment of the diaphragm. Now it's a stretching of the abdominal muscles of all 3 sheets, external, internal, oblique, and transversus abdominis, and it's an exquisite treatment for the abdominals so far. If I want now to reach the diaphragm, I have to go inside and then to press the inner part of the ribs, and just in this moment there is a provocation of the diaphragm. But in this moment, no provocation at all of the diaphragm. So I'll takes a little time. I go confluent with the rhythm of the breath to enter here deeper and deeper. And then I keep my fingers, and you see the difference. It's okay? Yeah. And so I can reach a little part of the diaphragm, not a big part, but at least this little part. Okay. So I go inside, and then I press from inside here. For you, is it more comfortable in this situation or in this situation without this hand?
뭐가 더 편하죠?
This or this? This. Most patients, they like to have here the resistance, but there are patients, it's too much for them, they don't like it. So I perform both possibilities, and I ask, and for most it's more comfortable if I practice it like this. Okay, on your left side, please. Oh, not on your back side. I forgot, not once again back, I forgot one thing. Because most often I can reach one part of the abdomen. You can see very well, lobe. This is just rectus, no, it's just external oblique of the abdominal muscles, and this is very well to find just one part of the muscle, because when I press like this there are other structures also involved. But now this is just the oblique external oblique. And for acute lumbago, often the trigger points are in this region, so it's comfortable to reach here locally like this and to know there is a problem or there is no problem. Okay, please try to reach this. But if you don't get it, then call me. I will show you often I can produce this. Okay, now on the left side. Here we can continue with the treatment of the intercostal muscles. It's very, very easy. Huh? It's very, very easy. If I'm here, please go with the hand to the neck. And you can turn a little bit like this and back. And so I can perform which technique? 2B, exactly. Okay. Same for the abdominal muscles. I can go in pre-stretch like this. Excuse me, this leg forward. And the knee rests in contact with the bed. And you open now. And now I have a pre-stretch for the external oblique. And so I can make here this facial stretching technique to find trigger points and to release this region. It's okay? Okay. And the other part we did together with quadratus lumborum, as I showed. Okay. So please, on back side, then on the side. So, go. 5 to 6 minutes, because otherwise probably it would be better after, and then you would have problems. Left or right side? Right side. Right side?
오른쪽만 네.
Right. Okay.
이거 상민쌤 전체 공유해도 됩니까 나중에?
됐다. Okay. We will have a. I feel here the crest. Huh? And this is very well to notice where is this iliac crest. Here. This is both. Then I have the dorsal iliac spine superior. And I have here the trochanter, the greater trochanter. Here. Okay. So I need another color probably. It's easier.
내 눈치 없어 그렇습니다.
일부러 말하면서 가시는데 아 내가 펜이 필요하다 하는데 아무도 못 알아들으니까 형도 빨리 못 알아들으니까
정민쌤이 가야지 안 하던 사람이.
저는 하지만 눈치가 있는 사람이라서 가만히
So if I make 3/3 of this iliac crest, then I have here the border for the gluteus maximus. It will run like this. But the gluteus maximus then go in this direction, and it runs up from here, also to here, over the trochanter major, and this part goes directly in the femur, and this, the bigger part, goes into tractus iliotibialis. But this is a huge muscle. Okay. This is gluteus maximus. The gluteus medius runs from here up to here. One finger under the iliac crest, huh? And the gluteus minimus runs here, here, goes a little bit ahead. Okay. And so you see in this region we have gluteus maximus. Here we have maximus and medius. Here we have maximus, medius, and minimus. And here we have medius and minimus. Here we have just minimus, and here we have nothing. Okay. And then we have the third. We have the piriformis. Easiest way to find his border is I go to the tuber ischiadicum. I take the middle, and this is the lower board of piriformis, and then I will find the muscle in this direction. I can't palpate it. It is under the gluteus maximus, and you see it's not completely correct. I think the gluteus medius will run more back, but in this area it is located. So if you make a palpation for the gluteus maximus, you know I have to look in this region, and very often trigger points are in this area here. Okay. So you can look at it. Then very often for the gluteus maximus is also here. You can take the muscle superficially. If it's too bad, you say stop. Huh?
너무 아프면
Okay. The other part of the gluteus maximus, it takes time to look, to provoke, and then to treat. Then, when we go to the piriformis, I just said, for me, easiest way is I need to take medium, and then it runs like this. I can't feel it. I can't provoke it. I know it is here. And if I provoke here, and there is a pain, the patient is familiar, I do it like this. I go, and then I move. And I ask, is there a changement in the pain or not?
움직임에 따라 통증이 바뀌나요?
No, it's every time the same pain? Okay. Then where is the origin for the pain? In which muscle? If it rests?
Which muscle?
Yes, gluteus maximus. Because performing this rotation, the piriformis runs like this and like this and like this. And so I press every time the same point in the gluteus maximus, but for the piriformis, I have different points. And so if the pain changes, it's piriformis, and if it rests, it's gluteus maximus. Perfect. So I can discriminate these two muscles. For me.
그래서 글루테우스 맥시무스에서는 같은 곳을 누르는 게 없지만은 안쪽에 있는 피리포미스는 지금 위치가 계속 달라지고 있기 때문에 이렇게 방금 같은 방법을 적용했을 때 각도에 따라서 통증이 변하면은 피리포미스를 만지고 있구나, 혹은 그 문제가 있어야겠죠, 피리포미스에 당연히.
Okay. The dorsal part of gluteus medius and minimus, I examine in this position. It's okay? Okay. And here, I feel tall bands. Here I can reach it quite good. It's no problem. Okay, this is one part. The last part is turn on your left side, please. Thank you. And this lateral part I treat and I examine in lateral position. There is the gluteus medius minimus. You see, I can go with my finger to the dorsal spine, to the anterior spine, and then my finger runs the fiber direction of the gluteus medius, and like this, it's like minimus. Medius, minimus. And I know, okay, if I'm here, I'm here. I have just the medius. Here I have medius and minimus. Yes. But to find the trigger points, the easiest and fastest way is I make again this provocation diagnosis. I take some body milk, and here I take a wooden tool.
Your photo.
Hooks and I have them here. I have two. One.
나무 툴만 했다면 스위스.
Okay. And I perform from this point, I know, insertion side, here, this. It's okay? It's every time same? Every time same. And then a second row. It's okay?
Sure.
It's more?
Yeah.
Okay. And you see this overview examination shows me very fast where are the hotspots. Third.
It's more.
It's more. Here? No? Okay. And so I detect very fast the regions with, which are sensitiver than the others. Okay, most was here.
Okay.
Yeah, and I find it again. And now I know the region where lies the problem, and then I'll go by palpation again, but I know in which region I have to palpate. And then I go, and here I'm looking for taut bands. Here I can feel it. Here too. Here too. It's okay?
Pain.
Pain, yeah. Local or?
Local.
Local, okay. And then for treatment, again, I would take a wooden tool. Then I would treat with the wooden tool, like this, or with the big one. I can here very comfortably go in this position. My fingers aren't charged. It's okay?
Okay.
It's not too much?
Some pain.
Yeah, some
Yeah.
pain. Okay. And I would move, which technique I perform now?
2A.
2A. Please lift your leg half a centimeter. Okay, and down. Just 1/2 of a centimeter. It's a big centimeter.
1.5cm 정도.
Great. Which technique I perform now? Exactly one. And now you lift completely the leg. More.
조금 더 완전.
More and more and more. Yes, and down. And up. And down. Which technique? 2B. You see. You are familiar now with these techniques. Okay. And so you can change one technique and mix it. Okay. And then you can perform technique 3 in this direction or in this direction. Very slowly. It's okay?
Yeah.
Great. Okay.
네, 일단은 방금 과정에서